All right, good evening, everyone. We're going to go ahead and get started. Thank you for your patience. We did have a technical difficulty with our streaming. We wanted to make sure everything was good to go. For board members that aren't panelists yet and elected official representatives, elected officials, Kim is continuing to make folks panelists. We ask that you be patient. We're going to open this meeting today. This is our April 19th, 2023 public hearing and regular meeting. We're getting started at 6:10. And we're going to go right into our public hearing agenda, starting with our one and only item, which is Mr. Ramon Rodriguez, President and CEO of Wyckoff Heights Medical Center. Mr. Rodriguez, the floor is yours.
Testing.
Thank you very much, Mr. Camacho, Ms. Leon, members of the board, all of the participants and people out in Zoom land. I'm very impressed with the fact that I have 3 different cameras looking at me. I've never quite had that experience. I think what I'm going to do is move back a little bit because I don't want to have my back to you folks. So this camera will show my bald spot. I have the honor to be the president of Wyckoff Heights Medical Center, and I've been there for 10 years. When I got there, there were rumors it was closing next week. There was a physician who came up to one of the painters. One of the first thing I did was, the place was getting kind of tired. It's still tired because we don't have the ability to raise capital. We only have to depend on government, and government has not come through in the kind of ways that I think all of you would like to see it come through. So he started painting the walls. The doctor came by and he says, "Why are you painting?" He says, "What do you mean? I'm told to paint." He says, "Well, we're closing next month, so we don't need to paint." Well, we're not closed. And we've done something, I think, really special. We've worked very hard to make the place a better place, a place that I get my health care from, a place that many of you, family members, get their support and health from if you are sick, very sick. You come to our emergency department. If you're not that sick, you probably have to wait because it's very difficult in that process to be in an environment in which you see 90,000 people a year, or 90,000 visits a year. I have 3 things I want to talk about today. The first one is to talk about one of the issues of a few that we have to consider as a community. We are very fortunate after 8 years of applying and getting to a place where through what is called a certificate of need, to get to a place where we were able to bring cardiac catheterization or PCI to our hospital. In the last 2 years, we have grown a program where if you're having a heart attack or if you're having some kind of problem with your heart, we can take care of you, catheterize you, put a stent in, deal with whatever your problems are. And we are in the 95th percentile of quality and safety in the United States of America right now. We performed 200 of these very important procedures, and the year before, almost as many. But we have a challenge, which I want to bring to all of you here. We often get people who come to us who have had a heart attack in some location. We recently lost one of our dear security guards who left his wife to go do the wash went to the dry cleaner, the wash, the laundromat, and he never came back. He had a massive heart attack. He was 52 years old. And when he was close to Woodhull. So when he got to Woodhull, it was too late. And we need to, as a community, and I want to challenge us and recommend to this community board to be a fulcrum of something that it will take a while, but we can do it. And that's the first thing. If somebody's having a heart attack, it's important to immediately start helping them. It would be great if everyone knew CPR, cardiopulmonary resuscitation, but that's not always the case. And so the first thing, it costs some money too. The first thing that I want to do is I want to offer 10 free classes for CPR so that Mr. Camacho and Ms. Leon can define 10 different people who can come to our classes with our ambulance service, which you've, I'm sure, seen. And you will, if you give me the names, numbers, emails, etc., we will be able to fit them in. The second thing I wanted to do, because I look around this room, and this is a senior center. I was once the executive director of Union Settlement in East Harlem, and we had 7 senior centers. We had 16 locations. Not one of them had an AED in the location, an automatic electronic defibrillator. Anyone can use them, just follow the directions. But before I get to that point, anyone can help somebody by pushing in the chest on a rhythmic basis, pushing on the chest, because every minute that passes, heart muscle dies. Time is muscle. Time is heart muscle. And so in addition to the 10 that I'm talking about, I want to provide for the community board 5 defibrillators. They're $1,000 a piece, and I want to give you 5 of them to put in places where you know they can be useful. And I do that in addition because I want to challenge our colleagues in other places, not only here in Bushwick, but in other locations, to build a process by which we can make the city a better place from the ground up. So I hope that you will work with us to do everything you can to make sure that we give people the opportunity to recover better, or at least not to die. Okay? The second thing I wanted to talk about today, some of you have in front of you, I don't see all of it, and behind you, there may still be some, and maybe you can put it on the Zoom, the 2 pages that we gave you. We gave you a leaflet that has one of those links. What are those things called where you put your camera on it and say again? Okay, so we have a QR code of an organization that we've created called the Safety Net Coalition of New York. Woodhull is a member as well as Wyckoff. We put this together over 2 years ago because the power of one is not capable of being able to really respond like the power of 30. So we've put together a coalition, a statewide coalition of safety net hospitals, of hospitals whose patients mostly have Medicaid or Medicare. In our case, almost 60% of the people who come to us have Medicaid insurance, and about 25% either have Medicaid and Medicare or only Medicare insurance. And both those insurances are insurances defined, focused, represented by state and federal and city dollars. And we are paid for any kind of procedure that you would get 1/5 of what commercial insurance pays for the same procedure. You know, there's this kind of mix-up kind of process which occurs when we think of big hospitals. Big hospitals do big things. They're large. They are places that we have certain expectations of. But when they remove somebody's gallbladder and we remove somebody's gallbladder, their results are not better or worse than ours. Their results are, to the extent that you can believe this, most of the people who have this capacity to have commercial insurance, employees of the government, et cetera, the doctor who treats them is getting paid 5 times more. The hospital is treating them is getting paid 5 times more than we get paid. So it's difficult for us to be able to build out, to improve, to do the things we need to do. So I'm asking all of you to sign up with the QR code, to do everything you can to engage elected officials and the governor of the state of New York to deal with what we call the 2-tiered system of health access, of hospital access, of doctor access. We've been working very hard, and we're very happy to see the progress that's occurring. Now, I don't want to confuse anyone. There is a reason why Wyckoff is still here, why Woodhull is still here, and all the other safety net hospitals. Even though we get paid about 1/5 of what the larger institutions get paid, because we get subsidized. We get assistance from the state of New York to keep going, which is basically a bad public policy. If you paid us correctly in the first place, you wouldn't need to subsidize us. And if we knew exactly what our revenue would be, we'd be able to plan better. We'd be able to do things in the way that all of us would like to see a $275 million organization that gets $150 million in support. If you paid us equal to what the commercial insurance rate is, you would see a wholly different organization, both at Woodhull and here, in about 5 years, because we're way behind. They haven't changed the reimbursement rate for people who treat people with Medicaid insurance since 2008. So they create this crazy idea, which is, okay, Medicaid is different than commercial insurance. Like your gallbladder is not as important as somebody who has commercial insurance's gallbladder. Everyone here needs to get preventive services. So for instance, you got to get to a certain age, but you'll have to get a colonoscopy. I have a friend here flying with me. That colonoscopy is necessary to make sure that certain things with respect to your digestive system are proper and you're not getting any potential cancerous tissue. We don't get to negotiate with the large insurance companies. They take it or leave it with us. We charge about $2,500 for that procedure. In the commercial insurance world, they pay the Presbyterians and New York hospitals $9,000 for the same procedure. They pay 4 times more to deliver a baby than they pay us. That's wrong. And we have begun through this coalition of safety net hospitals to advocate, to demand, and to deal with equality. Everyone knows that we have a problem in this country. This country was founded as a developing caste system, where the dominant caste defines what the lower caste is like. And in this country, more than any other place, the color of your skin, we are all Homo sapiens. We all have the same genes. We're all the same, but we may be different with respect to our skin color. And people who have a darker hue than I have are treated with less respect, less access to housing, and poorer access to what all of you want. It took us 8 years to be able to get cardiac catheterization here so we can save the lives of people. And they had all kinds of barriers, and we defeated those barriers. But we're doing it as a coalition, and I hope you will join with us. And those of you who are watching this on Zoom will look to the Safety Net Coalition. There's a website that you can look up and see what we're doing. Let me talk a little bit more about Wyckoff. You come to our emergency department. Right now, it's really hard. I'm not sure you're aware that every hospital in the country is having problems getting staff, and in the case of almost every hospital in New York City, especially the safety net hospitals, we are paying money to what are called traveling nurses who come and go to place, they're paid a higher rate, and we have to pay even more. Last year, even during the ending of the epidemic, pandemic, we spent a little under $1 million for these kinds of traveling nurses. This year, tax day, or was it yesterday? Yesterday was tax day. I paid my stuff a little earlier. We've spent almost $10 million so that we can make sure that every station, every place within our organization has a nurse. And it's a tough thing to be involved in that process, because you want to be able to have people with longevity in your emergency department, and that's become very difficult for us. So it's a challenge. When we were confronted with COVID, Wyckoff was a place where the first person in the state of New York died of COVID related of the virus. And we got to the point when the vaccinations were going forward, where we were doing up to 1,000 vaccinations a day. We closed down our cafeteria, not that we could go because of COVID. And we were providing vaccinations there. We were providing vaccinations on our 5th floor. We were doing everything we can to be responsive. At the same time, the larger hospitals weren't doing half of what we were doing. But the Brookdales, the Kingsbrook Jewish, all the other places, Maimonides, St. Barnabas, et cetera, were doing their part. Last time I was here, which was a while ago before COVID, I talked about bariatric surgery, the issue of helping people to get more healthy through that procedure. Since that time I spoke about it, we've become nationally recognized and accredited nationally. And we perform over 275 bariatric surgeries a year. And our chair of surgery, Dr. Liag Ahmed, that you met here, I brought him with me, is the one who does most of them. We have brought in since the summer what are called Da Vinci robots, 2 of them. We're providing robot surgery now at Wyckoff Hospital for general surgery, for urological surgery, and GYN surgery. Cutting edge, extraordinary ability to get people well by, it's very rough on the body when you have an open surgery. And we are doing something which is really dramatic and very beneficial. Thirdly, we have an extraordinary new breast cancer surgeon who has joined us and is building his practice. And it runs the gambit. We can talk about orthopedics. We can talk about all the other stuff. And you don't have to come to Wyckoff. You can go to Woodhull. You can go to any other place. It's your preference and your total ability to determine where you want to go. But Wyckoff is a different place than it was 10 years ago. And I'm proud to talk about what we're doing. But it's become imperative for us to come together. There are 4.5 million people that get served by the organizations that I'm a part of, that Coalition of Safety Net Hospitals. Mostly people who have Medicaid insurance or Medicare. In our area, within 2 miles of our hospitals, Woodhull and us, over 500,000 people have access to care. And we still have a lot of work to do. One of the things I would like to mention is something that we've embarked upon, which will become a reality about a year from now. Right now, there's an international company building a device for us called a biplane. That biplane will allow us to do similarly what we're doing with cardiac catheterizations. But it's a biplane that allows a interventional surgeon, a neurointerventionalist, to have a 3-dimensional view of someone's brain, to be able to go into large vessels and to break up a clot that's killing someone's brain tissue. Because again, like heart muscle, time is brain. And in doing that, we respond to one of the biggest difficulties that people in our communities face. Number one, heart attacks, coronary diseases. Number 2, stroke. And to be able to be in a place where in 35 minutes, you can be on the table getting a cardiac catheterization. Where today, unlike 20 years ago, where only the big giant places had access to that kind of advanced procedure. Today, it's affordable, kinda. Today, it's accessible if we push to have them in our communities. Every community should have the ability to take care of someone within 30 to 35 minutes, rather than an hour and a half. And what happens with the neurointerventional process is people walk out the door. People are not sitting in some nursing home in a bed having a tube down their throat because their brain tissue has been decimated by time. And the more this happens, the more it is possible for these procedures to be available locally if there is intention. I started out by talking about the fact that we in the United States of America are very good at deflecting what is a reality. Every one of us will be part of a cast, no matter what shade we are, because you become part of a cast when you reach an age like mine. As you get older, you are defined as the elderly, and you are ignored. You are not given the opportunity to do what you know you can do. And it should be the time in our lives where we have the benefit of having, if we are fortunate, raised children, helped other people, delivered and given everything of ourselves. And so we need to be in a position to have autonomy. We need to be in a position to be able to help, like all of you who are around my age, who come here and give of yourself and give of your time, those of you who are listening. You will all become part of that cast. We live in a caste system in the United States of America, and we're very good at complaining about other countries when we don't recognize that right here, right now, through the hundreds and hundreds of years of the development of what was originally our invention of not the founding fathers, but before, the invention of separating all of us Homo sapiens into different categories, mostly because of the color of our skin. Sometimes language, sometimes age, sometimes religion, and it's wrong. I believe that we can be collectively a movement to change that process, because in the end, it's not good for anyone. In the end, if you have somebody who migrates from another country and comes here and we do not give them access to care, they may not have gotten a polio vaccine. They may not have received a vaccine for measles. They where they've had access to health care, and ironically, they barely have it here. I think that you will see as we go forward a day in which, if we work hard, that access will be improved. There should be access for people who have migrated to this country, full access. There should be full access for anyone who comes to Woodhull or comes to Wyckoff. They should have the ability, and I'm doing everything I can, and we're doing everything we can to make that a reality. And we look forward, and hopefully it won't be a problem for any of you. We look forward to doing our best to reply to whatever your needs are. So I thank you today for allowing me to address you, to talk about, number one, the necessity for this community to learn about CPR, to learn about helping your loved one, your neighbor, or somebody to keep the heart moving, to keep the breath coming into the body by pushing on the chest or learning CPR. You don't have to know CPR to help somebody before the ambulance comes. And as I said, we will pay for 10 people to get for free to get CPR training at Wyckoff. And we are also going to buy 5 automatic electronic defibrillators for this community board to be able to supply that in places, and we'll help you with this, in places where you think it will be important. There'll be a day when every household has one of those, but right now they're not affordable. So we should do that, and we work with you. Secondly, We'd like your assistance in demanding equality, equity, social justice for access to healthcare. And three, I wanted to share some of the good works we've done at Wyckoff, and in my case, in the last 10 years, being the leader of a great many good people. And I plan to be here for a lot more years, God willing. Thank you.
We want to have a Q&A so people can ask you questions if possible, real quick.
Of course.
I know you have to go by 7, so I got we got about 5 minutes, 10 minutes, and we
Okay,
have a
thank
council
you.
person here too.
I'd
And
be happy
we-
to answer any
We're
questions.
here to support you. We have Ms. Davis.
Yes, I want to thank you, Mr. Rodriguez. Can everybody hear me? Yeah. I don't have a question. I have a comment. In 2015, my father had gotten sick at home and no one but myself could do the CPR. And I did it. And when we got to Wyckoff Hospital, the doctor had told me that the only reason why my father made it to the hospital was because of the CPR training. I'm just turning around and I'm encouraging people that you should get the CPR training, even if it's just for your family. Because the doctor told me that every minute counted from our house to the hospital. And she said that she was so glad there was somebody that knew CPR. So I am so happy to hear that you're going to give 10 slots. There are other places that you can go to get the training. If we can't get, I'm hoping everyone will take the training. So it's gonna be more than 10 people, but I ask you guys to learn CPR, even if it's just for your family. And the second thing, I just wanted to thank you. I had wrote a letter to you because for my father's care at Wyckoff. I lived in this community a long time, and Wyckoff had some very bad, reputation. And even my family, when we took my father to Wyckoff, they wanted him out of there. And I refused to let them move him. And I had no complaints about the care that my father gave. So I saw an improvement when we got to the hospital. So I thank you very much for all that you did for the hospital and the community.
Thank you. I'm kind of the conductor. We have a lot of people, place is clean. We do everything we can to respect the people who come to us and to be kind. I want to just say one thing. There's a reason I did what I did. I call it the 34th Street kind of process. And that is, if you remember Miracle on 34th Street, when Santa Claus went to the real Santa Claus, went to the Macy's Day Parade, he started telling kids, well, they make a very good ice skate here. They sell a very good ice skate, but why don't you go to Gimbel's and you can get one cheaper and it's even better. And that was this whole crazy thing. And then everybody started doing that, and everywhere, everyone was referring to everyone else. So I don't think there's any one place that can help a community. I want Woodhull to be the best hospital it can be, as well as Wyckoff, as well as any other place. So I think that the chair and the leader can very clearly go and send a little note to Woodhull and say, wow, you see what Wyckoff did? They did 10 free CPR and they're given 5 AEDs, and use that as a sword to get what you need. Okay?
Well, that'll be the first thing I do when the CAB meeting comes up, because I normally go to their meeting and I'm gonna tell them and see if they could double up what you can, because I
Mr.
know
Camacho, that's the way to go.
I know they have a nice little budget there, so maybe we can
Thank
get
you.
something more. Thank you.
We have some folks patiently waiting on Zoom. Mr. Ceballos, followed by Stephanie Anderson, and then Barbara Smith. Mr. Ceballos?
Yes, thank you very much. Good evening, everyone. My name is Felix Ceballos, CV4 member. And Mr. Rodriguez, thank you very much for being in CV4 and also for those, all the information, important information for our community. When I hear you mention, you talking about you're going to pay 10 class for people interested and take it. We need that in the community. And I hope in the future, you can continue to do that. And also, when you're talking about you're going to May free 5 AD, that's very important too. And thank you for all the information you bring to the CV4. Thank you.
Stephanie?
Hello, yes, my name is Stephanie Anderson, member of CB4. Sir, thank you so much for coming tonight and blessing us with all that information and for what you offered. I wanted to know about, you said that in some operations you use robotics or actual robots, or do you mean when they put the camera to enter the body?
There's a machine with very impressive software that allows a doctor to, in effect,
Oh, you have to, the microphone, put the microphone to your.
in effect, make them feel like they're inside the body. And they manipulate very sophisticated extra arms and provide surgery inside the body, but they do it through very tiny tubes so that you don't have to open up the stomach. And so your recovery time is cut in half or even more. And the Da Vinci robots have been in the other places, have been used for many years. They used to be giant things. Now they're kind of like the size of a refrigerator with a big computer next to it. And we have two of them. And we've been performing, I think we've done 500 procedures in the two of them. As I said, general surgery, which includes bariatric surgery. We've also performed GYN procedures and very positive results, and urological procedures as well. Very sophisticated, very, they make surgeons be even better than they already are.
And this has to do with small incisions rather than a huge.
That's correct. I mean, we've been able to do that as well through something that was a little less sophisticated, extensions where they would go in and work through and see a camera inside the body. But they are kind of a little bit less useful because you can go up and down and move your head. But the Da Vinci robots are extraordinary. They're just basically the standard of care now.
So this is brand new.
And we have them here.
So this is brand new right now.
The last 6 months we've had.
Oh,
It's taken us a while to get them here, but and the other part, one other thing, you're able to recruit physicians who basically say to you, I'm not going to do your procedures in their place unless you got a robot. So we've been able to recruit folks as well.
Well, thank you so much.
Thank you, Barbara.
Oh, can you hear me? Can you hear me?
Yes, Barbara, we can hear you.
Good evening, Mr. Rodriguez. This is Barbara Smith.
My friend.
I just want to tell the community, I have had treatments on 4 floors in Wyckoff Hospital. I'm telling you, guys, even if you don't be sick, you should go and see. I told Mr. Rodriguez when he came into Wyckoff, I wouldn't even walk on the same side of the street as Wyckoff. It was a cesspool, but now it's amazing all the different sites, rooms, and equipment they have in there. And just like Ivana said about her dad, I have been under some of the problems and stuff with health. That hospital has treated me excellent. And I'm
Thank you.
a senior and walk slow. The nurses and doctors are so caring in there. So if anybody want to know about the inside of Wyckoff, I can give you a map and lead you around in there, because I have had many a different, from the basement to the 4th floor, I have been on each floor having treatment. And Mr. Rodriguez, I thank you so much for uplifting all the doctors and nurses in there, because they say how you talk to them and you treat them. And I am so happy that Wyckoff is in Bushwick. Thank you so much.
You know,
I can't hear them.
Can't hear you anymore.
can you hear me now?
Yeah.
I used to take the bus, which was called the B58. Now it's called the Q58.
right.
From the block I lived in, I lived up the block from the Italian Ice King of Corona. And I would go to Maspeth to go to junior high school. I was bused there. Then I went to Newtown, and I went to City College, went away to go to law school. And sometimes I'd fall asleep and I'd wake up in Ridgewood. Little did I know that I would be the CEO of a hospital that serves Ridgewood and serves Bushwick.
Yeah.
What you said really touches my heart. And I'm grateful. I think of every person who comes into Wyckoff as my family.
Yeah.
My mother, Maria Rodriguez, I'm sorry. My mother, Maria Rodriguez, once came to the emergency department, and I went down to see my mom. And she said, they treat me really well here, but I don't want to get you in trouble because maybe they're treating me better than everybody else. That might have been true. I don't think so. But I like to make sure that everyone is kind, that everyone's respectful to each other, because that's what we need to do. And for me, I look at everyone, as I said, as if they're a member of my family, because many of them have my last name. And this is a place for me. It's the greatest job I've ever had. And I'm really grateful to you for what you said.
Thank you.
Thank you. I see a few other hands raised. James Stewart, and then,
Oh my God, Jimmy Stewart.
yeah, I'm sorry, who's after James?
Mr. Ceballos has his hand
Mr.
raised, but he's already
Yeah,
been.
thank
he's
you.
already
So
been-
James, Mr. Ceballos, and then 2 members of the public. Go ahead, James.
Okay, thank you very much. Good evening, sir. Thank you so much for coming to our community board. So just to introduce myself, I'm James Stewart. I'm the pastor of a church here in Bushwick. Also, one of the many jobs I do in ministry is as director of the spiritual care department in hospital in Long Island. And so my question to you is regarding the spiritual care department at Wyckoff, because I often visit families and patients there, and I've tried to make connection with spiritual care, but it seems like it's not as active as it probably could be. And so I know that that's an important part, having been in healthcare chaplaincy for almost 20 years. I know how important that pastoral care and spiritual care is to the health of patients and families when they come into the hospital. And so I was wondering if there was a possibility, or is there a connection that I can make to be able to speak with someone at Wyckoff?
Yes, and I, Reverend, I think you're right. That's an area which we can really improve. And I think there is an access point that will get right to the issues you talk about. And that access point is me. So you come to our 3rd floor at your leisure when you have a moment, or call the general number and ask for Ramon. And we'll set up a time we can get together. And if you don't mind, I would be honored to come and speak at your ministry, at your church.
We can do
On
both.
the topics I've been talking
both
about.
things. Yeah, both things we can do, and we will do that in short order. So thank you so much.
Thank you. Thank you very much.
Thank you. Mr. Ceballos?
Yes, thank you. Felix Ceballos again. Just I want to say, Mr. Rodriguez, when you was talking about your mom, about your mother, I'm glad when you say also you open the door for the whole world, because no matter what the color, when we're talking about people, and that just mean a lot. Thank you.
You.
Thank you. And the members of the public? Pastor Ross, B. Ross?
Hi, good evening. Actually, I grew up in Bushwick, and it is an honor to be a part of the meeting this evening and to hear the wonderful things about the hospital, because there was a time when I too did not want to walk past the hospital. And I have a nephew that was recently in the hospital there, and he was treated very well. So just thank you for the invitation. And I'm actually here as a guest with Dr. Phillips. And so thank you, Dr. Phillips, for inviting me, and thank you everyone for allowing me to be a part of your meeting. God bless you all.
You're welcome and thank you.
Who's next? Deborah Hicks?
Good evening. Bushwick has a serious problem with drugs as well as mental health. I have a neighbor who has the police, 4 or 5 police cars come with 2 ambulances, these 3 or 4 times a day, 4 days a week. And I looked at this and I said, that's a waste of resources. And I wondered, could your hospital, all the hospitals the mayor has a plan for the homeless, but there are people who live in homes who have chronicity. And could you not look at a program where social workers are assigned to these chronic callers, people who are chronically taken to the ER, to follow up with their meds, their needs, because we're wasting resources by sending 4 and 5 squad cars and 2 ambulances for 1 person to negotiate. And if they were assigned someone, perhaps we'd have better utilization of our city services. And that could be something that Wyckoff could, work with the city about, in terms of not having triage, but actually having a unit where they send out those who are chronic, 10, 25 people, they're assigned to them. And it reduces the likelihood of a waste of resources when someone more seriously needs the services. This person needs her meds. When she's off her meds, she's off the wall. So it's chronic. And I'm looking at other people who might have the same problems with their families. We don't need police, we need help.
Thank you for your comment. First of all, a place that has the resources that you're talking about, we don't have an inpatient behavioral health center, which then would allow us to do other things with outpatient. And it's a limitation, and it's one that I feel terrible about. Woodhull has a very substantial practice, both outpatient and inpatient. And quite frankly, when someone presents, and someone almost every day presents who's decompensating or is trying to hurt themselves, if they need inpatient services, we find places like Woodhull, but it's so bad in the city. And nationally, it's so bad in the city that sometimes someone who lives in Bushwick, we can't find a bed, we send them to Staten Island. So I think this mayor has talked about it, has a philosophy. We could agree or disagree with what he says, but he recognizes that there is a big problem, just as the previous mayor did. But it is without a doubt, and you're right, someone who is decompensating, someone who needs, as you said, meds, someone who needs to be calmed and focused upon. I think the police department does as best they can. Not everyone is terrific at it, but at least in the A3 precinct, I see a lot of commitment with the people who come to us when somebody is decompensating. But I'm the first to tell you that this is not one of the areas that we are very good at. But thank you for your points. And it is without a doubt a major issue in our community.
Thank you. So we have one that want to speak from the public. Please feel free to leave a message in the chat. If you'd like to contact the board's office, you can also email us at bk04@cb.nyc.gov. Kim will drop that information in the chat. We're happy to pass along any questions that weren't answered this evening to make sure that they're addressed.
Ramon, thank you so much for your presentation and being a friend of Bushwick throughout the years. With just some training, would it be possible once we do the 10 to get a community-wide training in the event we can raise the money or funds? Because I know our councilwoman just allocated $10,000 for us, and possibly as if we could find more sponsors, could we do this as a community-based workshop? Is that possible in the future?
I don't look at this as an end. I don't look at this as an end. I look at it as a beginning. It's something in which I'm trying to, from a well, priming the pump. We're trying to prime the pump. I have no. It works, and I'm not one of the teachers of that process, but I would be happy to do more than what I talked about today with respect to teaching as many people as possible who, if something happens in their home, in their place of business, in the laundromat, as I talked about my colleague and friend who passed sitting in a laundromat when he had a massive heart attack. So yes, and I'll work with you and the community board, as I will be working with the community board in Ridgewood as well.
A brief point of clarification, unless something has changed, I believe the council member's office allocated 5,000 in discretionary funds. So it's okay, clarified. So I know
Thank you.
our
Whoops.
second vice chair wanted to close out our public hearing. Raul?
Hi, Raul Rubio, second vice chair. Ramon, thank you for coming through. Just because they made a comment just now talking about mental health, I'm one of the coordinators that helps with the mental health first aid, and just the same way you want to do CPR for us, I'd be willing to try to arrange mental health first aid trainings for your staff as well, if that's something that
would be
we
great.
can. I can reach out to your office, maybe
Please.
like later on this week or next week, and then we can kind of work out some details for that. But I definitely would
That
like
be
to do that.
terrific.
You got it.
I mean, that would be terrific. Thank you very much. Thank you
Yes,
very
thank
much.
you.
Thank you for coming.
So that closes out our public hearing this evening. We will now move on to our regular agenda, starting with the first roll call. Board member ready? And for those that are in person, if you have yet to sign in, please remember to sign in. Isa Abni. Stephanie Anderson.
Here.
Okay. Please be prepared to mute, folks. Grace Ates. Joanna Bennett.
Here.
Joshua Brown. Present in person. Raul Brown.
Present.
Robert
Present.
Camacho. Is present in person. Melissa Carrera Solano. Present in person. Felix Ceballos.
Present.
Andrew Choi. Elvina Davis. James Fitzgerald.
Present.
Freddie Fowler. Should have called in, might be on the phone. Okay, Freddie Fowler is there on the phone. Joanna Fuentes.
Present.
Christopher Graham.
Freddie Fowler here.
Got you, Mr. Fowler. Christopher Graham. Ann Guiney.
Present.
Hadia Harrison. Tanisha Honeygan.
Present.
Barbara Jackson,
Yeah.
Virgie Jones, Luisa Jose, Nicholas Kaplan, Koebe Koti, Cassandra LeVey,
Here.
Mary McClellan, Imani Mitchell,
Present.
Desmond Monroe, Zuma Navoa, Kyle O'Rourke,
Present.
gotcha Z, Kyle O'Rourke, Asire Polite, Raul Rubio. Oh, gotcha, Sire. And Raul is present in person. Eliseo Ruiz, present in person. Milagro Sandoval,
Present.
Bernardina Shell is excused. Barbara Smith,
Present.
Maria Soler is excused. Dustin Sonborn,
Present.
Annette Spellin,
Present.
James Stewart,
Present.
Ben Tucker, present in person. Jerry Valentine, Tashana Wade, Carlotta Williams,
Present.
Hey, it's the last time here. I wasn't
20
acknowledged yet.
oh, 29. 29 board members present. That constitutes a quorum. Thank you.
Tashana
I did
Wade
not hear
put in the
Tasha-
chat.
Okay, that's 30. That constitutes a quorum. Thank you, everyone. We will now move on to the second agenda item, which is this acceptance of the agenda. Is there a motion from the board? Melissa Carrera Solano made a motion. Is there a second?
Somebody second it?
Alvina Davis, second. All in favor?
Aye.
Any
Aye.
opposed? Any abstentions? So moved. Agenda item number 3, acceptance of the previous meeting minutes. I kindly ask for the board to table the meeting minutes as they are still a work in progress. Is there a motion?
Barbara Smith. makes
Raul made a
to
motion.
table. Barbara
Joshua
Smith
Brown
seconds.
seconds. All in favor?
Aye.
Any
Aye.
opposed? Any abstentions? So moved. And next we have our annual election of executive officers. And Dustin Sonborn will be assisting with this process. Board members, please be ready as there will be nominations called from the floor. And we have a roster of folks that are already on the slate. Dustin, I defer to you.
Okay, hello, everybody. Welcome to the 2023 board elections or excuse me, executive board officer elections. So we will start basically by reading off the current nominees for each position. All the board members were asked to nominate. We have between 1 and 3 nominees for each position. But we are required to take nominations from the floor as well. So we're going to go through the list and I will name each position and who's nominated and give everybody a chance to make any nominations from the floor. And from there, everybody who's online should have a Google form that they received in the email, and you can make your picks there. And I believe we will be, if any nominations from the floor will be added to the list. Does that sound right? Everybody on board? Everyone ready?
Sounds good.
Okay, great. So I'm going to start with our first position for chairperson. Currently, Robert Camacho, our fearless leader, and he is the only nominee for chairperson for this next term. If anybody, any board member would like to nominate anyone else, this is the time to do so. And this is not one of those, but I'm just will be, I believe I have to call 3 times for each of these positions. So that's the first call. Second call, anybody, nominations from the floor. All right, third and final chance to nominate any other nominees other than our current chairperson, Robert Camacho, for the chairperson Community Board for this coming 2023-2024 meeting year?
No,
Okay. All right, so moved. That will be our only nominee. I'm not sure what the requirements are, whether we actually have to
Yeah.
vote or not, but
So the
congratulations.
recording, go ahead. Recording secretary has to cast a vote.
Gotcha.
So Mr. Ceballos. Mr. Ceballos, are you there?
Yes, yes, I'm sorry. Can you repeat the question again, please?
You, as the recording secretary, you would just have to cast a vote because Mr. Camacho was uncontested for the role of chairperson for the board for 2023, 2024.
Okay,
So you just
recording secretary.
cast a vote.
Recording secretary.
You say you cast a vote for Robert Camacho as chairperson. That's what you guys say.
he's not. doing
Yes.
it.
Okay.
Yes,
So
yes, I cast the vote, yeah, for
Okay,
me to.
perfect. Thank you.
There we go.
Mr.
You're
Ceballos
welcome.
casted the vote. Congratulations to Mr. Camacho.
Congratulations, Mr. Camacho.
Yes.
Congratulations.
I don't know if they're good or
Yay.
bad, but thank you.
Congratulations.
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 you.
Congratulations, Mr. Camacho.
Thank you, thank you.
Congratulations.
I'll speak later on. Could we keep moving with the agenda?
Okay, moving on. One note that I forgot to make at the beginning was that any of our board members who are not using the Google form should have got an email with my phone number. And so please feel free to call me with your votes when the time comes. As I said, for all these, please listen to all the names, and for all the positions that we're voting on, you'll be voting at the end. So we'll move on to the next. For first vice chairperson, currently Joshua Brown. We have 2 nominees, and we'll be accepting any more from the floor at this time. Right now, our nominees are Joshua Brown to continue or to have another term, and Raul Rubio is our other nominee. If anyone has another nominee from the floor, now's the time. All right, second call for a additional nominee for the first vice chairperson position. Third and final call for another nominee for first vice chairperson. I'll check my phone. So moved. We'll have our 2 nominees for first vice chairperson. Our electors, the board members, please make a mental note or a note of who you'd like to vote for, and save your votes
Justin,
till the end.
sorry to interject. So just an update. I spoke with Josh Brown and Raul yesterday, and Joshua Brown accepts the nomination and Raul declines respectfully. So we have only one nominee, Joshua Brown.
All right.
Okay,
It is
super.
uncontested. So our recording secretary, if you will
Yes.
cast a vote. Yep.
Yes, I cast a vote for Mr. Brown.
Thank you. Congratulations, Josh.
Congratulations.
Congratulations, Josh.
Hey, Josh.
Congratulations.
Congratulations.
Okay, and thank you for that, Melissa. All right, so moving on to the second vice chairperson, currently Raul Rubio, and I believe all 3 of these have, or all 3 of our nominees have accepted, but if not, please let me know. We have 3 nominees at present. Raul Rubio to continue on as second vice chairperson. Our second nominee is Felix Ceballos, and our third nominee is Asira Polite.
Hi, this is Asaya. I actually declined the nomination.
Saya. I screwed their name up. Yeah. All right. So decline. So we have 2 nominees, Raul Rubio and Felix Ceballos.
Dustin,
Desmond, sorry.
I'm sorry, Dustin, I decline.
Okay. All right. We have 1 nominee at present, Raul Rubio.
Congratulations.
Wait. I have to do
The
3.
recording secretary has to
Hold
cast the vote.
I have to take 3 chances for any nominations from the board right now. So if anyone else would like to nominate someone, this is the second call for nominations from the floor. And going 3 times, is there any nominations? for second vice chairperson, right now we have one nominee, Raul Rubio, to continue on as second vice chairperson. Okay, Mr. Ceballos, take it away.
Yes, I cast the vote for Mr. Raul Rubio. Congratulations.
Congrats, Raul.
Congratulations, Raul.
Congratulations, Raul.
Okay, moving on to the recording secretary. We have currently Felix Ceballos, who is doing a wonderful job every time and tonight as well. To continue on, and another nominee in Eliseo Ruiz. I'm going to double check now that everybody accepts their nominations.
Eliseo declined the nomination.
Okay, so we have one nominee at present, Felix Ceballos, to continue on as recording secretary. I'm taking nominations from the floor right now. I was going once. Once again, for recording secretary, we have one nominee, Felix Ceballos. Would anyone like to nominate anybody from the floor? All right, third and final chance. Anybody? Okay, one nominee. We might have to call the parliamentarian in. Are you allowed to vote?
Yeah.
to
Right.
vote for
The
yourself?
parliamentarian has to cast it.
We'll let the parliamentarian
I,
cast it.
Joanna Bennett,
it.
cast a vote for Mr. Ceballos to continue as recording secretary.
Thank you.
Congrats, Mr. Ceballos.
Congratulations.
Thank you.
Congratulations.
Thank you.
Okay, moving on to financial secretary. Currently, Eliseo Ruiz. I'm going to name our two nominees and see if they both accept or decline. Eliseo Ruiz also nominated to continue on, as well as Jerry Valentin has been nominated. Mr. Valentin, do you accept the nomination or decline?
I don't believe Jerry's on.
Okay.
Oh, he can't do it.
From our nomination committee, was anyone in touch with him earlier?
The person has to be present.
Yeah, he would have to be present. So
Okay. All right. So we have one present nominee for financial secretary. That's Eliseo Ruiz. If anyone would like to make a nomination from the floor, now's the time. This is for financial secretary. Okay, going twice for financial secretary is currently Eliseo Ruiz. He is our only sole nominee. If anyone has another nomination from the floor, now's the time. And final call for a nominee from the floor for financial secretary. Okay, take it away, Mr. Recording Secretary.
Yes, I cast the vote for Mr. Eliseo Reed.
congrats, Eliseo.
Congratulations.
Ray.
Congratulations, Alice.
Okay, moving on to the treasurer position. Currently, Jerry Valentin. We have three nominees. I'm going to check if they accept or decline the nominations. We have Emini Mitchell, Eliseo Ruiz, and Emini?
It's pronounced Imani.
Imani, excuse me. Do you accept or decline the nomination?
I accept.
Okay, great. Eliseo Ruiz, I believe, cannot accept the treasurer nomination as the financial secretary. So that leaves Jerry Valentin as our other nominee. And he is also not here right now. So we have Imani Mitchell as our sole nominee for the treasurer. Would anyone like to nominate from the floor? All right, second call for any nominees from the floor for the treasurer. Currently, Jerry Valentin, though he is not here at this meeting, so he cannot be reelected. We have one nominee, Imani.
So Dustin,
Imani
just
Mitchell.
a point of clarification. Jerry did accept for treasurer. So
Okay.
even though he's not here,
Okay. So we have, excuse me, we have two nominees, Jerry Valentine and Imani Mitchell. If anyone else would like to add one from the floor, now's the time. I'll say that that was the first one. So second, again, we have two nominees for treasurer, Imani Mitchell and Jerry Valentine, our current treasurer. Would anyone else like to nominate from the floor? Okay, and going three times, for the treasurer position, two nominees, Imani Mitchell and Jerry Valentine. Okay, those will be our nominees. So please remember what you're thinking and cast your votes once we're done naming the other two positions. And again, that will be on the Google form, or if you don't have internet access or you're not familiar with the forms, you can call or text me. My number's in the email announcing the meeting for everybody. Okay, so we will move on to the correspondence secretary, currently Elvina Davis. We have two nominees, Elvina Davis to continue on and Barbara Smith. Do either you accept or decline the nominations?
I decline Barbara Smith.
Okay. Barbara Smith declines. That leaves us with one nominee, Elvina Davis. If anyone has nominations from the floor, now's the time. Going twice. Any nominations from the floor for correspondence secretary? Currently Elvina Davis and currently our sole nominee. Three times for a nomination from the floor for correspondence secretary.
Yes, I catch the ball for Abina Devi.
Okay, great. Congratulations.
Congratulations, Abina.
Okay, and last position, but not least, our parliamentarian, currently Joanna Bennett, who's also nominated again, and Christopher Graham. Would either of you like to accept or decline your nominations?
Christopher's here. He's not here.
I accept. Joanna Bennett accepts.
Great.
Christopher's not here.
Well, if he's
I
not
don't see
here
him.
no, and he didn't accept, then it's not eligible.
Okay, super.
right.
So we have for our final and
Christopher Graham is here.
oh, great. Christopher, do you accept or decline your nomination for parliamentarian?
I decline the nomination respectfully.
Okay, okay, thank you. We have one nominee for parliamentarian. If anyone would like to nominate anyone different from the floor, now's the time. Second chance for nominations from the floor for parliamentarian. And this is our third and final call for additional nominations from the floor for parliamentarian. We have one candidate, Joanna Bennett, to continue her term as parliamentarian.
I catch the ball for Miss Joanna Burnham.
Thank you. Congrats, Joanna.
Congratulations, Ms. Bennett. Thank you.
Congratulations.
All right. So
Congrats.
before everyone fills out the form, just as a reminder, the board previously asked for candidates that are present to speak and share why they are interested in running for that particular role. Dustin, if you want to just announce the one position.
Okay, I believe it was just for treasurer, which was Imani Mitchell and Jerry Valentine. Jerry Valentine is our current treasurer, though I don't believe he's here right now. So if Imani, if you want to take it away and let us know why you would like the position and how you think you'll do, please take it away.
Hey, y'all. So I don't show my face often, but my name is Imani Mitchell. I feel like I'll be great because this is new for me and I just want to learn. I'm passionate about being the community board. And I just feel like I would learn from you guys. So I think I'll be good at this. And I'm very passionate. Thank you.
Thank you, Imani. You cut out a little bit, but I hope folks got the gist of it. Board members, we good? All right. Well, please take it away, board members. You have the link. If anyone needs assistance filling out the form, you have the number in the email we sent to contact Dustin, or you can just let us know in the chat. Let us know over Zoom. If you're really struggling, we can help you. We are tracking. Once we have the 30 board members that are here this evening responded, then we will reveal the results. For anyone here in person that has not been able to fill out the form, I can pull it up on my phone. Everyone, board members here, are we good? Some board members that are calling in the past, you do have to disconnect unless you can call from multiple lines on your phone. You may have to end your session on Zoom right now to reach out to Dustin if you need his assistance, and then call back into the meeting.
And just one other note, if you had the form open already while we were reading the nominations, please refresh it and you will see that it's only for the one position now. It's been updated to the only thing we're voting on.
17 have submitted so far, 18 and counting. Oh my gosh. It's a close race, y'all.
I can't find my form.
Hi, Barbara Smith casting her vote. Okay, bye.
Casting my vote in the chat because I can't find
I
it.
just lost my thought. I'm on two at one time. I'm on
20
it.
and counting.
Oh, yeah.
Don't see the form.
Dustin, can you put your number in the chat?
1 minute, I'm on the phone. I will do it in 1 sec.
Where will we be able to locate this form?
So it's in the email that was just sent shortly before this meeting. It should be close to 5 p.m. with the final reminder. The link is in there with the instructions for the election.
Okay, thank you.
If you're having, if you're having trouble, any board members having trouble,
Found
Kim
it.
can also send the link directly to you.
Okay, I'm looking for the form as well. Yeah, I just put Dustin's number in the chat if anyone wants to see it.
I sent that message in chat to Dustin, but I can't find the form.
Okay, James, you need the link. Or
The
go
form
ahead.
is in the email that it will say BKCB4 April 2023. Is right after that, the red words. Please read
Yeah.
below. Is going to say it right
Yes.
there.
That's the one.
5:16 p.m.
Yes. Thank you. I see it. Thank you.
All right, 27 responded, only 3 are missing. Oh, 28, 2 missing. 29. Who's the last one left? Yeah, no, it's all anonymous,
I probably got the last 2. I'll text them to you
Oh,
now.
we
It's the last.
have 30. So unless we had some board members join late, which is possible. So Dustin, let us know if you've submitted already.
I have submitted. Oh, I've submitted mine, but I can submit 2 others if you like. Or I was going
Okay.
to text them to you. Or do you want me to?
Okay, yeah, if you want to text them to me, that's fine. Yeah.
Okay.
Celeste, you're probably seeing mine. This is Christopher Graham, because I wasn't recorded as the numbers.
Okay, perfect. And Dustin's gonna send 2 more. Once we get those texts, I just got something.
All
We
right, I
will-
sent them both to you.
This is the last call for all board members. We have 33 votes or 33 responses. All right, I asked the board permission to close out this election. Everybody, are we? Can I, are we, okay, we have a general consensus, everyone online, so there are no more voting. There's no more voting. We have to close out, yeah. Thank you. We have 34 responses that have come in. And we are no longer accepting any more responses, so I hope everyone voted. And the results are, it's very close with 52.9%. Jerry Valentine remains the treasurer for the next year. And at 47.1%, Imani, very, very close race. We thank you both. And congrats to Jerry. Thank you, board members. It's very close. It was 50% for the majority.
All right, that's great. And we didn't need Rupert Murdoch to
right.
contest the vote.
Right. So we will move on now. Joanna, did you have a comment, Joanna?
All was just a joke. It's saying we didn't need
Oh.
Rupert Murdoch to contest the election, did we?
Oh,
It ran very
had a joke.
smoothly.
Oh boy. So we will now move on. Thank you, board members. We got through our election this year and it is 7:32. So let's keep this meeting agenda moving with Mr. Camacho's report, our chairperson. Camacho.
Thank you, all of you, for giving me an opportunity to support the Bushwick community and be a leader. Without you guys, I could not be a leader because I need all yous, and we all need to do the right thing for Bushwick and the people that we represent, and making sure that our tax dollars, city agencies do what they have to do for our people. I'm gonna go with my agenda on Thursday, March 16 at 6 p.m. Hope Garden TA meeting. A lot of people complained about the intercoms and most of them were addressed, and they had last meeting. I know Celeste was with us. She'll fill you in on that was last month, this month's meeting that we had. Saturday, the 18th from 12 to 3, Women's Month at 480 Knickerbocker Avenue. Hugema was giving out awards on Women's Month, and I went there. I was the only 2 guys there, but I went there anyway, and I left early. On Tuesday, the 21st at 10 a.m., the Bushwick Community Partners is still meeting at starting their meeting at 422 Central, starts at 10. Come over, please. We met on the 21st. On the agenda was discussion on summer programs. They have the Fresh Air Fund caps for kids. There is a fee from 8 to 15. I don't know the fee. I'll submit it to Celeste. Whoever wants to join, that they were on the agenda. And then Tuesday, the 21st, at 11 o'clock, after I finished that meeting, I walked over to Washington Irving Park for Way 30 years. He retired, Way. Y'all remember Way? He used to go Way. Yes, I know I took a picture with him, sent it to Celeste. I don't know if she put it in the newsletter, but we didn't look too good there. Maybe that's why she didn't put it, but we were okay. 30 years, man. I said, bless him. We're going to miss him. On Wednesday, the 22nd, 6 p.m., the EPC PRC meeting. On Thursday, the 21st at 1:45, HPD. Me and Celeste met with HPD on Zoom about 455 Jefferson Avenue. Street. I'm sorry, I put Street, Avenue Street. The male silent seekers that are living there now, they're already there. I know PD got an update for us, because I know they should have. I've been getting a couple of complaints from them hanging out there 2, 3 in the morning and partying. So we want to make sure we address that issue. Thursday, the 23rd, CB4 Shape of Bushwick event. On Friday, the 24th at 10 o'clock, I went to Patankins at 1027 Broadway. On Friday, the 24th at 6 p.m., the NAB, which is the Neighborhood Advisory Board through DYCD, which is Department of Youth and Education. On Monday, the 27th, I went to the Woodhall CAV meeting. At that, there were presentation. Let's see. I have. They're looking for people to join the advisory board. Please, community board members, if you guys want to join the advisory board. On the agenda was they have now an ambulance care service. They would go around for homeless people. There's an ambulance bus that they have now. I have on here. I'll give it to Celeste to send anyone. Primary care safety net clinic that they go around to some of the areas where we see some of the homeless that may need services. They can go on a bus and they could get service. So now Woodhall is having an ambulance service for homeless people. Also, Tuesday the 28th, CB4 staff meeting. There's going to be a recommendation that I will be put out there in regards to Kimberly. And I'm going to also do recommendations in regards to our district manager in regards to both in regards to a merit increase. And I hope that the board will allow us to do that. Hopefully on recommendations, I'll fill you in on what it is and more or less, and Celeste will fill you in on Kimberly's. On Tuesday, the 28th at 6 p.m., the HOU meeting. On Tuesday, the 28th, the neighborhood community, neighborhood police officer, sector Charlie at 10 Forest at Riseboro building. On Wednesday, the 29th at 2 a.m., me and Celeste I was on Zoom really with the chief of department, Shell, on Zoom. I don't know, they're creating a new program. So obviously, if they're trying to now have Brooklyn North in regards to the quality of life issues and any issue, at least like if they don't have anything else to do. I know I phrased in regards to them doing HPD matters or homelessness matter. They have their own to be worried about in regards to the quality of life to be dealing with all this. I said, are they going to eliminate a 311 or are they going to eliminate the community boards? Because that's what we do. So obviously, Shell didn't like the question. He said that if the complaints that we handle works for us, then it works for us. He's only referring them to precincts within Brooklyn North that have hard times getting services through the city. So I don't know if they're trying to reinvent the wheel. So I told her we don't need to reinvent the wheel in Bushwick. So obviously, you know, they cut me off of that one. On Thursday, March 30th from 10 to 4, I went to 195 Montague, TW. There was a gun violence forum. And guess what? I was on the panelist. So I don't know how good I did, but yes, there was. I went there. I went downtown Fulton on Thursday, the 30th, CB4 District Office Committee, which I just spoke to you about the recommendations. On Monday, April 30th, I went to the Woodhall Hospital for a funding that Congresswoman Nydia Velázquez gave $2 million for. On Tuesday, April 4th, the Brooklyn Borough President's Office, there was 2 presentations. One presentation was the Community Board Advisory Civil Engagement Commission, and the second was the Brooklyn Comprehensive Plan. which is from the Borough Director, Land Use Department of Community Board. Okay, now yeah, let me keep going. Where was I? Lost my agenda. Wednesday, the 5th, the executive board meeting. On Thursday, April 6th at 11, the Easter egg hunt we did on Wyckoff with Ujima and the NCO officers and Kirk Bonds, Cooper Street Block Association. We went out and we gave Easter baskets to Wyckoff Hospital on Thursday the 6th at 1 on Zoom. We were with Sound, Mind, and Music Festival meeting. Saturday the 8th from 11 to 3, Hope Garden Easter Hunt. I was there, and thank you, Miss Spelling was also there. And then from there, we went to Metro Church. They also had an activity on Winfield between Wilson and Knickerbocker. A lot of kids. It was huge. It was nice. I was also dancing with the Easter hunt with the rabbit. So I don't know how good that was. I know someone recorded me, but on Tuesday, April 11th from 12 o'clock at 480 Knickerbocker, Ujima, Kurt Bonds, and the A3 Precinct Council, and also the YCO had the paint and play day. So the precinct is doing a lot of things while they were off on the Easter school recess when they were off. So they were doing, we also had we were supposed to do a movie night, but obviously they had me as the coach for their basketball thing. And I wasn't feeling too good, me being their coach. So I was running up and down. So we didn't get to do the movie night. Wednesday, April 12th, 10:30, the district service cabinet meeting. Presidents agencies, I want to let you guys know so you can see how we're working with all the city agencies if we have issue. I know Councilwoman Sandy Nurse office was there, NYC of the Aging, Brooklyn Brooklyn Public Library, Councilwoman Chief of Staff Gutierrez, District 32, DOB, Department of Buildings, National Grid, DOT, the Brooklyn Borough President's Office, the liaison, the A3 Precinct Council, A3 Precinct is there, Con Edison, Department of Department of Health and Mental Hygiene, Department of DS, Department of Social Services, NYCSB, Small Business District Attorney, and those are all the city agencies that come to our meeting, and we make sure that we address whatever complaints and issues that we may have. On Wednesday, the 12th at 12, the A3 Precinct and Ujima and Cooper Street did graffiti removal on Halsey. On Thursday, April 13th, 1475 Gates, Blue Chip. That's where I was doing the basketball tournament. They had 40 kids doing a clinic. Then the officers were playing basketball with the youth. The youth was a little mad, but they won. Thursday, April 13th, CB4, Civil, Public Safety, Religion, Health, Human Services, Veterans Committee. Friday, the 14th at 9, the RAD team. Celeste was there. She'll fill you in on what was going on. On Sunday, the 15th from 11 to 1, Irving Square Park. I went to the park to clean and help them out. I know there's people here that maybe later on an announcement will give us a little quick view on what's going on. On Monday, the 17th at 4 p.m., I went out to the Troutman Open Street Earth Day event. Starts this weekend. People don't complain to the office. They're closing the streets down. I think it's for a couple of Saturdays a month, all the way till October. So there's more information in back. We have our flyers, and we will submit it to our newsletter to let you guys know when the street closes for Open Street is. The 18th, Tuesday, 1 p.m. We will be having, there was a meeting with the A3 Precinct Council at a youth. We had a youth meeting. The flyers are over there with Ujima, the A3 Precinct Council, YCO. There's going to be a youth summit with the kids at 11:39 Bushwick, and they're gonna be talking about, we want to hear what the kids want. It's gonna be a youth summit. We want to listen to what they want. What is it that we can do, and how is it that we can help them? We want to listen to them. Some of the youth are saying that they're tired of us forcing them to do what they don't want to, but they want us to help them and see services and things that they may need. So we could, in regards to, everybody ain't gonna play basketball. Everybody don't want to play soccer. They maybe want time to do a recording or do rap, because sometimes they're in the hallway hanging out doing their rap music because it sounds good in the hallway and the echo. So get them out the hallways and let's give them some playtime and place where they can do what they want to. So there will be there's a flyer in the back when the day is, and we're gonna be there and listening in. I know officers are gonna be there in plain clothes to ask them how they started, to talk to them, to tell them they're just like them, and we're here to support them and help them. On the 19th, I also went today to the clergy, but I had another meeting at 12, so I stood there. Maybe our clergy, one of the board members that is on the board, can give us a brief what's going on there. And today, the full board meeting. And I think that is, wait before I end it, that it's it, yes. Any questions, comments, concern for me? Oh, yeah. I'm gonna go for, you want me?
I have a question.
Yes.
Could you please explain to me, there's no more Hope Garden. What is the name of those buildings now?
It's still Hope Gardens. It's just under different property management. So it's not NYCHA, it's RAD.
That's
RAD.
So it's RAG. So if you're
RAD
talking
Hope
about
Gardens.
RAG Hope Garden.
It's called, yeah, it's Hope Garden, but it's the RAD conversion, but it's called Penrose.
The program is RAD. The management is specifically, the company is Penrose. And you also have other companies that are involved that provide different types of services for the renovation, for the social services, et cetera.
Acacia is the service. Acacia Network is the social service network, which is they get services for our seniors. They do everything. So
yeah, they do everything. Yeah, because some people say Hope Garden, some people call it another name, and I had got a couple of phone calls saying, what is the name, since they say it's not Hope Garden. 422 is under Hispanic Family Services. It's not under Hope Garden.
That's right.
So people have to understand, when they go to 422 Central, it's not connected with Hope Garden. It's under the organization Hispanic Family Services. Thank you.
Yeah, so it's,
Penrose is the landlord.
yes,
Penrose is the landlord.
yes.
And yeah, and Hispanic Family Services runs 422 Central.
Yes,
the service
it's a
provider,
service
yes.
provider.
Yes.
Right, they run it, yeah.
All right. Thank you, Barbara. I see
Cassandra has her hand
Cassandra
raised.
has her hand raised.
So I have a point of clarification. What does RAD stand for?
Rental assistance demonstration.
Okay, and are they like city affiliated?
It's a federal program.
Okay, thank you.
The longer acronym is PACT RAD. I think it's Permanent Affordability Communities Together Rental Assistance Demonstration, but it's PACT RAD. And that is what many housing developments across the city that are, the land is still owned by NYCHA. However, the management is changing in order to cover the cost of renovations.
Thank you, Celeste.
You're welcome.
I'm also gonna read out some of the attendance. Since Grace Ace, excused 2, absent 5. And a total of 7. So, yeah, you need to, I can hardly see the way you.
I can summarize on Mr. Camacho's behalf because it's on the phone. So Reverend Yates, it's health related, her absences, and she did not submit a renewal application. I did speak to her prior to this district office committee meeting, which was on March 30th. She indicated that she's been back and forth between the doctors and the hospital, and she apologized to everyone. She did mention that she misses the board. You know, she wants to be more involved, but unfortunately her health does not allow her to. I did share that if she is interested, there are other opportunities outside of being a formal board member, such as being a committee member, and that time will come. She'll let me know. We'll stay in communication. And then Hadia Harrison indicated she would not submit a renewal application, so I won't go into detail about absences. Tanisha Honeygan was flagged. However, there are some board members. It's very important. If I don't hear you when I call the roll call, I can't mark you as absent. So it's let me know, put something in the chat. Just say something, even let me know after the meeting, like, did you hear me? Otherwise, I will have no idea that you're on, even if you are on the meeting. So if anything is incorrect, please let me know. I did leave messages and I sent emails to folks in reference to the information that's being shared now. Koebe Koti moved to California and indicated she is no longer able to serve on the board. Mary McClellan, also health related. Mary did submit a renewal application. However, it is in the borough president's hands. I've spoken to them at length about some of the membership challenges the board members have had, including Ms. McClellan. So it remains to be seen. Some of us that were part of that committee on the executive board know Ms. McClellan's still in the hospital. She's rehab specifically. And she's trying her best to get better. She sounds well. I spoke with her on the phone. She misses everyone. And she hopes to be better soon, but she's taking it one day at a time. And Kyle O'Rourke also indicated he would not submit a renewal application. Maria Soler was flagged for 4 unexcused absences. And then there were also some attendance warnings. So this is under the 3 unexcused absences or 6 excused absences. Both James Fitzgerald was flagged for 2 unexcused absences, and Bernadina Shell was flagged for 2 unexcused absences. And that is the attendance update. Are there any other questions for Mr. Camacho's report or anything regarding membership attendance? All right. Seeing and hearing
But
none.
Does that mean that you're looking for more members now?
So the way membership works is that when the applications are open, generally, I would say the end of the year through like February, the borough president's office will accept those applications. So the application, I believe, closed. It was supposed to be on February 14th. They extended it to February 23rd. As of now, it is the borough president's responsibility to send us the membership list, which I heard is coming soon. So it should be this week. Before the end of this month, we will be getting new board members to replace the vacancies and also fill the seats for those that no longer choose to be on the board.
Okay, thank you.
All right. We will move on now with the rest of the agenda, starting with the introduction of elected official representatives. Please raise your hands if you are in attendance. Is anyone in person? Anyone from our elected official offices? Come up, please come up. Yep. All right, we'll have folks in person introduce name and contact information only, please.
Hello, everyone. Where am I supposed to look? Okay. My name is Hercules Reed. I'm with the mayor's office. I'm the new Brooklyn North Borough Director. So I just wanted to come in person and put a face to the name so that you all can see me. I plan to be attending your meetings. Please add cabinet meetings. I heard nobody from the mayor's office was there, but I will be there at the next meeting to represent his office and take back any concerns to him and to our office to make sure that it is handled. I had the privilege of working with our mayor when he was the Brooklyn Borough President. So some of these
Excuse me,
places.
respectfully, I've just name and contact info right now. And then we'll have time for announcements later.
Sorry, contact H Reed, that's H as in Harry, last name Reed, R-E-I-D, at cityhall.nyc.gov.
Thank you.
Thank you. Next.
Hi. Hello. Hi, my name is Pablo Rivera, and I'm from
Assemblyman Eric Delan's office. We are 366 Cornelia. It's right on Cornelia and Irving. And the phone number that you can reach me there is 718-386-4576. Thank you.
Thank you. And I see Fran.
Hi, everyone. Sorry I can't be there in person. My name is Fran Sanhuesa. I'm community organizer for Councilmember Sandy Nurse. We are at 56 Pennsylvania Avenue. The office phone number is 718-642-8664.
Thank you. Brooklyn Borough President's Office.
Hi, I'm Lacey, Legislative Director for Brooklyn Borough President Reynoso and Rep for CB4. I'll put my link in the chat and we'll just say everything Celeste said about appointments is correct. The list should be coming in the next few days, but definitely before the end of the month.
Okay, thank you, Lacey. Congresswoman Velasquez's office.
Hello, everyone. Jonathan Betancourt here on behalf of Congresswoman Nydia Velasquez. I'm the community liaison for Bushwick, and our office's phone number is 718-599-3658.
Thank you. Senator Salazar's office.
Hi, good evening. My name is Maria Valdez from the Office of Senator Salazar. Phone number is 718-573-1726.
Thank you. Councilmember Gutierrez's office.
Hey everyone, Juan Mayoncela here from Councilmember Jennifer Gutierrez's office. Our phone number is 718-963-3141. And I'll drop my email in the chat. Thank you.
Thanks, Juan. Assemblywoman Davila's office.
Hi, good evening, everyone. My name is Yvette Lopez. I'm the Communications Director for Assemblywoman Maritza Davila. We are located at 249 Wilson Avenue and can be reached at 718-443-1205. Thank you.
District Attorney Gonzalez's office.
Hello, good evening, everyone. This is Jonathan Pomboza. The DA's office is located at 350 J Street, and we could be reached at 718-250-2817. Thank you.
Thank you. All right, seeing no other hands raised, no one in person, we will move on to the agency and community-based organization representatives. If there are any agency, city agency, state agency representatives, now is the time to introduce yourself and provide your contact information. This applies for any local community-based organizations. Please raise your hands. Is there anyone in person, agency representative or CBO representative? All right, seeing no hands raised. Oh, okay, all right.
She told me now. Rob Solano, co-founder, executive director of Churches United for Fair Housing, 718-360-2906. Address is, we are on AUP high schools. You have any high school kids there? We're doing stuff at the high school for organizing. We're also at St. Martin Tours Church.
Thank you. Anyone else? All right. If we have, oh yeah, Bushwick Community Partnership.
Hello, everyone. Cynthia Peña Ortiz, Program Director of the Bushwick Community Partnership at the Coalition for Hispanic Family Services.
Thank you. Do you want to provide the contact info, Cynthia?
Yes, I'm putting that in the chat right now.
Excellent. Thank you. All right. If there's no one else, we will move on now. We were informed by the Community Affairs Unit that our Deputy Inspector, the commanding officer of the 8-3, is not available. And the executive officer is also not available, so no one will be providing a report this evening. However, if the board would like to ask Officer Lopez to say a few words, the board is more than welcome to. All right. It seems as though everyone is good. All right. All right. So we will move on now with the rest of the agenda. So the district manager's report, that is my report. Let me find my notes. So I do have a staff update for everyone. Some of you may know already, Sharon's last day on payroll was March 22nd. So that means we are able to hire a community associate. There will be a job posting available soon. If you are interested in more information, please contact the board's office. You can speak with myself, Kim, Mr. Camacho for more information. And as Mr. Camacho referenced earlier, I did make a recommendation to the executive board for a merit increase for Kim that will come up under recommendations. And an update on our lease agreements. Our previous lease ended June 30th of 2022. The new lease was not prepared in time for July 1st of 2023, or excuse me, 2022, meaning the start of the current fiscal year. We have been in communication with the Department of Citywide Administrative Services, the building management, while Sharon was still in the office from July to December of 2022. She asked on a monthly basis, how much do we owe you in rent? When can we pay you the rent? They said we do not have a lease. We were provided with the lease in November of 2022. We reviewed it. It was discussed with the district office committee, the executive board. We clarified some concerns. Principally, there was language that stated the building would close at 6 p.m., where the board usually uses the space until 8 for certain committee meetings. We wanted to make sure that that was still a possibility. It was resolved. The lease was signed. It was returned. We are still waiting on the controller's office to approve and for the lease to be memorialized and for everyone to be able to disperse payment and rent. We have communicated this to the building management, so they're not under the impression that we are delinquent. So hopefully this involves Borough Hall as well, and Borough Hall has been supportive of us in this process. So hopefully it will be resolved soon. And there have been some issues recently. Board members received a notification regarding the newsletter, which was delayed this month. Unfortunately, the web-based platform MailChimp that we've been using since the pandemic started no longer supported our audience size. So we have over 1,000 community members signed up for our newsletter. We were unable to send newsletters because they wanted to charge us. They only accept credit cards. The board's office does not have a credit card. We were pursuing a different vendor. We had everything lined up. We submitted all the paperwork. Thank you, Kim, for supporting that process. However, this vendor, before I could hit send, we have to have the account unlocked, or we have to have the received goods before we can confirm purchase. That is the city's purchasing policy. I spoke with them at length. I even called Sharon just to make sure there were no exceptions to this rule. And she confirmed there are no exceptions. Unfortunately, they were not willing to work with us, so we were unable to work with them, which resulted in me having to pay for it myself with my own credit card. So that is where we are now. I will be seeking reimbursement while we look at alternatives, but we wanted to make sure that this board still had access to both the meeting information that's provided at the beginning of the month, as well as the newsletter, using a platform that will not inconvenience the staff and having to learn a completely new tool to provide a service we've been providing consistently. And other issues, running an office, you're going to encounter a lot of different things. You know, sometimes the internet goes out, which means our phones go out. Sometimes we lose access to our public drive on our computers, which happened last Friday. Our public drive contains all of the notifications, any information. It contains the board members' contact info. We do have backups, of course. But it remains to be seen whether we will recover that information. And we had to resort to using some of our backups in order to provide some of the documentation you have this evening. When that drive is down, we cannot access the tools that we need to do our job. So we have to find alternatives. We are doing our best to do that. And with that said, I want to say thank you to the board members for providing support. It has been very difficult. Everyone knows how much work Sharon did within the office. There are a lot of block party applications, a lot of street event applications. So Kim and myself, we are doing our best to facilitate that process. I'm the primary staff member responsible for making sure that those are processed and approved. And we will continue to do the best that we can until we bring on a third person. And I believe that concludes all of my updates this evening. I will forego the meetings. I will say in reference to Mr. Camacho's announcement about RAD, there was the RAD meeting last week. There have been ongoing concerns with RAD and management, specifically in regards to the treatment of tenants, in regards to renovations, in regards to communications. They provided a very comprehensive update. There have also been some situations recently with the staff. I do not attend those meetings on a regular basis. Mr. Camacho does. My best impression is that they are doing what they can to address those issues. However, it appears as though what they have been doing has not been enough. And so right now they are exploring what could possibly be done to further address issues with supervision and with staff, and with the fact that the staff and the supervisors are in the same union, which means that they cannot write them up, which creates further issues. But that is just one example of how complex these changes can be and how they affect the community, because at the end of the day, that management company is in this community for the tenants. And if they are not serving the tenants, then they are not doing their job. And so that is something that all the elected officials, the representatives, Mr. Camacho, continue to try to hold them accountable to do in those meetings. And that concludes my report. Any questions? comments? If not, going once, going twice. We will move on to committee reports, starting with our Joint Civic, Public Safety, Religious, and Health Human Service Senior Citizens Veterans Committee meeting. Ms. Spellin, if you would like to start first.
I'll give it a shot. Okay, we met on Thursday, April 13th. We had a very extensive presentation by the representative from the New York City Civilian Complaint Review Board, better known as CCRB. She gave a lot of information, and she gave her contact number as 718-628-8400. She further stated that CCRB is going to have a Brooklyn board meeting at 6:30 p.m. on May 10th at Restoration Plaza, 1368 Fulton Street in Brooklyn. A lot of people don't understand what CCRB is. It's the agency that you can call or go to when you have a complaint about policing and the way police are handling certain issues. As I said, she says they were going to have a Brooklyn board meeting May 10th at 6:30 at Restoration. Along with that, we had a request for street naming for Reverend Lula Mae Phillips. For those of you who didn't know Ms. Phillips was a community activist who did so much for Bushwick and for many of us here. She bought a house, she renovated the house, she had the children in the house. She was active in this community for over 39 years. And she was a member of the A3 Precinct Council. She did so many different activities for the community board, including parades, children's events, Thanksgiving turkey drives, holiday toys, and children for children in the community. She worked very hard to deal with the drug dealers and was a block watcher for drugs, stolen cars, and child abuse. The bottom line is the request for the co-naming received overwhelming verbal support from the committee members and public attendees for the street naming. Excuse me, because this one is sort of personal to me and some other members on this board. But the bottom line is we unanimously agreed that the street naming should go through. The other presentation we had was from the founder of Hip Hotic Helps Global. And they were requesting a letter of support for their organization. It's supposedly a nonprofit organization that works in supportive housing, academy, life skills, career training in all boroughs, employment, affordable housing, placement for vulnerable populations. One of the things that we did, because there were several locations that she mentioned, and she also mentioned that she got a letter of approval from Community Board 1 and Community Board 3. We had several questions that weren't answered, and the bottom line is we asked for a business plan to be presented to us so we could address this a little further. She said that she had submitted a documentation to the Community Board. However, we're not sure what that was. The bottom line is Community Board member Barbara Smith recommended that she provide a letter of support for the street naming of Ms. Phillips and Barbara, oh, I'm sorry. Going back to the street naming, Barbara Smith recommended that we approve the street naming for Ms. Phillips. And Barbara Jackson recommended that we table the letter of support for this organization until we got further information. And that's basically it at this point from our committee. Ms.
Thank you,
Jose?
Annette. All right, just a point of clarification, Annette, the number that you mentioned in the very beginning, that's the board's office number. Do you have the CCRB number?
Oh, I'm sorry.
That's okay.
Let me see if I have that number.
Yeah. Just want to make sure. So if you don't have it accessible at the moment, we can also look it up and provide it, but just wanted to make a note that that's the office number.
No, I don't have it at this moment.
Okay, no problem. We're happy to share that, and we can see if we can find that online. Drop the information in the chat if it's publicly available. All right.
I
don't know if Luisa Jose is on. Luisa? Okay. If she had anything to add, Luisa, if you're there, you can. I see one hand raised. I cannot see the name.
Joanna Bennett. I
Go
just
ahead,
want to
Joanna.
ask, yeah, Miss Spelling, where is the street that you want to rename for Miss Phillips?
Oh, okay, let me see.
Eldridge Knickerbocker.
It's Eldridge Street and Knickerbocker Avenue.
Thank you.
You're welcome.
Other hands? I see another hand. Barbara?
Yes, the street naming, Reverend Phillips Lula Mae is the sister. The street naming is for her sister that passed, Mildred Phillips.
Thank you.
Yeah, these are two sisters with the same last name. So some people got confused, but the street naming is going to be code name of Mildred Phillips. Thank you very much. She's been a long time supporter of anything that happened in Bushwick. She had foster children. She gave out food to homeless people on any given day that she made in her house and took it outside. She went to supermarkets and collected food that they probably would have threw out. And she went home, she cooked it, and she fed people, not only in Bushwick, Bedford-Stuy, East New York, and Brownsville. So these two sisters was a real staple. Reverend Phillips is still on Eldred, and she's trying to fix up another property right now to put mothers and children in out of shelters for permanent. And I really suggest that the community board supports this naming of for Miss Mildred Phillips. And she was a nurse that took care of many of people in Bushwick and all over and spent money on those families of sick people when she seen they needed something out of her own pocket. Thank you so much for your time.
Madam Chair, I can I take a moment of your time? Ms. Spellings, I have her sister here. Maybe she could just say a little, give her a few minutes to speak in behalf of.
Yeah, I would love it, Reverend.
Of her, if I may, of her lovely sister that I knew very well.
Yes, Reverend Phillips.
I thank all of you so very much for allowing me to speak tonight. It's an honor and it's a privilege and it's a pleasure. I thank God for all of you. And I have to say, my sister and I were deeply involved in providing for the children and families in the community, especially during the crack era. It was so bad. I'm a nurse as well. And it was so bad if we reported the care that was receiving in this community, we would have reported really about all of them. It was so very, very bad. And my sister was dedicated. She was a community health nurse. She worked for the Visiting Nursing Service of New York. She had patients all over the city. And when she would go and visit her patients, they had no bedding, they had no food, and they would send them home. And so you would think, how could anyone send patients home like that? But people were being sent home, and I'm sure they might still be being sent home the same way, especially people who don't have families. So what we would do is we will go out, buy linen for them, sheets, pillowcases, towels, and we buy food for them, enough groceries to last at least a week. And then we get in touch with people in the community who may have extra food, and we would get that food and take it to them. So she was extremely active and very, very much involved, and she cared about all people. Now, she was feisty, energetic, always had something to say, always. And you can ask Mr. Camacho about that. Always, she always had something to say. And she had a great sense of humor. But she was extremely dedicated to Bushwick. We grew up on Moffett Street. We left, came back, and we lived on Evergreen and Decatur. We went to Halsey, 296, and we went to PS 113 that was torn down. So a lot of you don't know where that is because it's no longer around. Now it's a Episcopal home, I think. Yeah. So I thank all of you for just considering this, and I'm so appreciative. I don't have the words, and I thank you all so much. Thank you.
And I love you, and I love your sister so much. I remember her when I was a young man, and I used to go to the precinct when Dennis Herron was there, and she always used to give me a prayer. She always say, she always prayed for me. That was one thing. She was always, give me your hand, and she did it in the middle. She didn't care who it was or where it was. She did it, and I was so heartbroken when you was on Zoom, and I saw your face, and the first thing I did was ask for your sister, and you told me she passed away. I didn't even know it, and I felt so heartbroken. But I know she's here with us, and I know that she every time if this board approves that, every time we look at that sign, I'll know that she's always in our heart and always with us. So I want to thank you for giving us to you, for us, you giving us to us. So we want to thank you.
Thank you. Thank you all so much. Thank you.
Right. If there's nothing else for this item, we thank you, everyone. And we will move on to our next report for this evening, which is the Economic Development Permits and Licenses Committee. Melissa?
Good evening, everyone. Can you all hear me? Yeah, okay. So the Economic Development and Permits and Licenses Committee met on Tuesday, April 11th, 2023. And I am going to try to be as brief as possible. You can find the notes in my report. Thank you, Celeste, for all of your support in the meeting. So we had a total of 5 establishments present. The first establishment was seeking a full liquor license, Selva LLC, located at 1329 Willoughby Avenue, between Wyckoff Avenue and St. Nicholas Avenue. This is the location that is on the street of another business that Bushwick has had a lot of issues with in the past year. But David Castillo and Sergio Barrios, the owners, have explained and expressed to the committee that their plan is to open an art space, a bar cafe with a gallery to show artwork. This will be a full service cafe open in the morning. Baked goods from Venezuela, Brazil, and Colombia, where the partners are from. And the intended hours of operation are as follows: Monday through Wednesday from 8 a.m. to 2 a.m., Thursday through Saturday from 8 a.m. to 4 a.m., and Sunday from 8 a.m. to 12 a.m. So we did inform this business of our stipulations. As you all know, no amplified music outdoors, no sales of alcohol past 12 a.m. on Sundays, and all outdoor spaces must be closed by 10 p.m. The owner was in agreement with all of our stipulations. There are some additional comments if anyone's interested from some concerned residents. There are a lot of concerns, especially in this area with just the influx of establishments and nightlife venues opening up. And if you have any more questions, you can always follow up with the board. Next up, we have Key Bar at 143 Troutman Street, looking for a full liquor license located between Central Avenue and Evergreen. This is a bar tavern. The applicant is looking to operate and take over, formerly known as Farewell, and then someone else took over. So this is a new management taking over, hoping to bring in some cuisine and also their hours of operation are as follows: Monday through Wednesday from 10 a.m. to 2 a.m., Thursday through Saturday from 10 a.m. to 4 a.m., and Sunday from 10 a.m. to 12 a.m. And of course, we mentioned our stipulations and also asked them to get involved and get to know their district CBO list and their NCOs. And next up, we have Pitanga Wellness, located at 207 Star Street between Irving and Wyckoff Avenue, looking for a full liquor license. Establishment is a restaurant. Pitanga is a small cafe that has been in the neighborhood for 8 years. I personally go there often to get a smoothie. Wellness place. They know their neighbors. They've reached out to their residents upstairs and other partners and bars around the block. They're looking to expand and grow their business to start serving dinner at the location right next door, which was formerly a Thai place that never opened up. Their hours of operation are as follows: Sunday through Wednesday from 8 a.m. to 12 a.m. and Thursday through Saturday from 8 a.m. to 2 a.m. We also informed the establishment of our stipulations, and they were in agreement with them. And we had a member of the community who was also there, excited for this expansion. Next up, we had 269 Stanhope Street, looking for a full liquor license, located on the corner of Irving and Stanhope Street. This is a private event venue, space, and bar. The applicant did not attend the meeting. But Pastor Ron from directly across the street from Living Waters Fellowship at 265 Stanhope Street did attend the meeting and shared that their church has been at the same location since 1985. They have children's ministry services and they know about the 200-foot law. So just for context, the 200-foot law really just limits the type of alcohol that's being served within 200 feet of a school or a church. This establishment would be triggering that 200-foot law. And the pastor also did note some previous issues and doesn't want to see that happen again with this establishment. They were not present. Just want to reiterate that. And lastly, we had Xanadu on Star. 262 Star Street, looking for a full liquor license, located between Wyckoff Avenue and St. Nicholas. This is a bar, tavern, and a roller skating rink. Varun, the owner, returned to the committee as requested because we had some more questions about the establishment in our previous meeting in March. And they did express to us that this is a plan to open a roller rink. And one second. They did plan to have soundproofing. I do want to just share that there is a plan for transportation to hopefully have an Uber pickup zone to help with some of the traffic. And they will have a plan in place in reference to excessive drinking. And they have, this will be a multi-space use. And they have contacted nonprofits. And there has been a mixed in support for this establishment because the establishment is a large space that can hold up to 1,000 people. So we did receive some concerns from longtime Bushwick residents. We did receive some support from longtime Bushwick residents. So we gave an opportunity for folks to really speak out and share about their concerns or support during the meeting. And the intended hours of operation that they presented are here. Let's see them here. Okay, so they are as follows: 10 a.m. to 2 a.m., Monday through Thursday, Friday, Saturday, 10 a.m. to 4 a.m., and Sundays, 10 a.m. to 12 a.m. with our 12 a.m. no sales of alcohol stipulation. So I know that there are people on the call that want to voice some concerns, and we also have some people here in the community who want to also share out just about the establishment. So I do want to give people an opportunity to do that, but I do want to say we want to be mindful of time. If we can limit it to 2 minutes per person. No, 30 seconds. All right. Celeste gave me the 30-second warning. So just the one, because this has been. Okay, that's a great question. So Mr. Eliseo asked, no, I appreciate your question. So the question is, why do people want to speak on this establishment on number 5? Because it's the roller skating rink that holds up to 1,000 people. This is a large venue space who are hoping to open till 4 a.m. And they will be serving alcohol. They have programming due in the day for children and families. But there are big and valid concerns about the quality of life from the Bushwick residents directly across the street, as well as concerns from nonprofit organizations in terms of the use and just, the viability of having a large venue space, another large venue space in Bushwick. So we want to give the opportunity because this is also located around the block from Moonrise, which has given us historically, now we all know, a lot of challenges in the community. So there are a lot of concerns for this business. So Celeste, I'll kick it over to you.
So just one point of clarification before folks speak. I know we have our assembly member with us as well. The point of clarification for 269 Stanhope Street, the applicant, the church is technically next door. So you mentioned across the street, the church is 265 Stanhope. It is next door. All right. So assembly member, we defer to you, and then we will have everyone else speak.
Okay. Can everyone hear me?
Yes.
Okay, good. All right. So congratulations, Camacho, to another appointment to the community board. Kudos to you. You've done a lot of work. And we all appreciate you. I just wanted you to know that. Furthermore, I wanted to get on because I think it's important that people understand that not only has Moonrise been a thorn in all of our tuchuses, I live right around the corner from there, so I see everything that's happening day in and day out. And the only recourse of action that I have is to tell people to call 311 because it's completely out of my hands. And we got to do whatever is lawful. In terms of Star Street, Camacho and I did go to see the place. The way the plan was presented is a lot confusing because if we're going to have roller skating, it's either going to be roller skating or it's going to be a party venue. How you do both, I don't know how you do that. First off, roller skating takes a lot of stamina, right? And so people that are drinking and roller skating at the same time, that is a complete big liability, right? For insurance, which is not our problem. That's something they're going to have to deal with. But I was under the impression that there would be more days of roller skating and less partying. That's not what's going to happen. And unfortunately, both young men are very nice, but there was not enough transparency. I think the way they presented to you guys was not a complete depiction as to what's going to happen there. And that's why I am completely worried. And I did call the owner today and said, you're going to have to go back to the drawing board because it just doesn't make sense how you're going to have roller skating. And then at night, it's going to turn to this huge party venue where 1,000 people are going to be there from 12 to 4 a.m., right? Wyckoff Avenue, starting all from Willoughby all the way going down to Flushing Avenue, If you have not been there on a Saturday, is a complete tobacco. It is a mess, a mess. It is horrific. Please let me remind you that we have, the mayor has opened up a 600-bed asylum shelter for men. All right? On Star Street, right up the block. We are asking for trouble. I've talked to the mayor. Not the mayor himself, but his folks. I had concerns in terms of policing. They're not going to give us more police. So what are we doing? We got to be careful about what we do. All these liquor licenses that are being kind of clumped up in one area is not healthy. I mean, it generates revenue for the businesses, all of that. But what it brings to our community sometimes is a lot of problems and no resolutions. So again, I'm not trying to hurt anybody's business. I'm just saying, go back to the drawing board, because the community is very, very vigilant as to what's happening there. And I don't want to be the one saying, yeah, it's great, get another permit there for 1,000 people. And then we have completely lost control of it. So if we're going to do it right, please, let's try to do it right.
Excuse me, Ms. Davila, we have to be concerned about the time. Please excuse us. We have to, other speakers need to be allowed to speak. Please excuse me.
Oh, okay. I thought assembly members could talk. Anyway, it's okay.
We've got a time check here for the entire program. Please excuse us.
No, I understand that. I understand that. All right. So that is my concern. I had other concerns, but since I can't bring them up, I'm going to shut up right now. Okay.
Oh my goodness.
You can bring them up.
I'm going to be
just a point. You can bring them up. Just a point of clarification. It's 455 Jefferson
That's
Street.
the shelter for the asylum seekers. It's not on Star Street. All right, Assembly member, if you wanted to summarize, we want to be mindful. We still have other committee reports, but we of course welcome your feedback. If you want to summarize your other concerns for everyone to be aware, and then we have to.
Well, Jefferson Street is on the next block, is up the block. It's literally up the block. Jefferson is on the next block.
That's true.
So it's not far, whether it's up the block or not, it's right there. I just want you to be mindful of that, but that's okay. I think I've spoken enough. Thank you. I'm good.
Thank you. We also have someone from a CBO that I guess that wants to speak to. We're gonna do this quick, please.
Oh my goodness.
Let me know when the clock starts. So it's Rob Solano, just for the record, Rob Solano, co-founder and executive director of Churches United for Fair Housing. I will just skip the intro and get to, I think, 4 or 5 procedure points that I'll do in 30 seconds that I believe this applicant has circumvented. One, in your process on page 1, you clearly state that the applicant must submit a letter of no objection of CVO of the property, so you can see clearly what the application is going to be. The applicant needs that for a liquor license. He did not show that in his place. The construction site is literally a construction site right now. The applicant's about a year out, which means his applicant is a year early. The applicant triggers the 500-foot rule, which is a public questionnaire that he must have submitted. He has completed the questionnaire and has not shared it with the community board. It is a questionnaire that is important for anyone to trigger the 500-foot rule. Why this applicant has not shared, I do not know. Also unusual, the applicant is triggering himself the 500-foot rule. He has a Sultan room, the Turkson right across the street, which I spent 10 years in community B1. I've never seen an applicant trigger itself in the 500-foot rule. The applicant also replaced a tenant called the Goldstein Restaurant Supply, which had thriving cabinet manufacturing jobs that employed Black and Latino residents that had wage skills and usually living wage in that attendant space, and the attendant use of the space no longer there. And finally, the SLA is deeply concerned about adding liquor licenses that never existed before in a given space. Usually liquor license continues to go on with new licenses after and after. It is rare for the liquor license to give a brand new one, especially to a 1,000-person space. And I'll close in summary. I stand in solidarity with the Assemblywoman Marissa Davila. I also spoke to State Senator Julia Salazar this morning, who was also deeply concerned and will also show his opposition in Albany to this application. So now we have Senator Salazar, Assemblywoman Davila, and Churches United for Fair Housing, who does not support this application's liquor license. And I wanted to say that last sentence. This is about the liquor license. The applicant open up a roller rink. The applicant can open up anything the applicant wants to desire. This has to do with serving liquor in a place that have never served liquor before, and I stand in opposition of this applicant.
Thank you.
I have for just real quick for some point in regards to the individual's package in regards to programming and membership. It says we will occasionally interrupt skating for concert and special events. This is his package. Our live music program will gladly end, not going past 12 a.m. Our many occasions will have mixed programming that includes live music, component of skating, funk, and live funk band performing for skating. The important part here is our intent is to have no more than 3/4 non-skating events per week. So if there's 7, and on top it says we have skating sessions 7 days a week. So in the bottom, he says we have 3 to 4 non-skating events per week. If there are 7, that means he's gonna skate only 3 times, so everything else is party. With rain days, time slots, held for skating. Then I see in his food drive, his restaurant that he's in his example scheduling, he has Sunday, 12 a.m. ending, Monday, 12 a.m. ending, Tuesday, 12 a.m. ending, Wednesday, 12 a.m. ending, Thursday, 7 p.m. Doors open at 7 p.m., so it doesn't say what time he's closing. Friday, he says 4. Saturday, he says 4. But in his permit, he says Monday through Wednesday, 2 a.m., Thursday, 4, Friday, 4, Saturday, 4, Sunday, 12. Then he submits petitions for signatures. But on top of the signatures, it says roller skating ring with a restaurant and a bar. So he has everybody signing. So everybody in the family says, hey, there's going to be roller skating ring, you know. Then he goes to the stores and he gets all the businesses that are in the area. And it says he wants to get an open premises liquor license, runs as a venue. He has 5 sheets from different addresses, St. Nicholas, 200 Star, these are all restaurants, 207 Star, and then he has the DOJ NYC. Then he has another batch that he gets to sign that says roller skating ring. So everybody signs the roller skating rings. He gets a venue from 4 a.m. He gets the people to sign. So I think this is misleading. He's not fair with this community, and something needs to be done when it comes down to recommendation. I know that I have spoken, and we have to make a recommendation because we do not want the SLA to give them what they want. So we need to make a recommendation and then let the elected officials worry about that later on. Thank you.
Thank you, Mr. Camacho. There are some folks on that would also like to speak. Please state your name, your affiliation, if you're a resident, business owner, so on and so forth. And please be brief. Starting with Michael Ashley.
I'm in a meeting.
Michael, you're muted.
Hello. Hi, I live across the street from this venue, and I'm just really concerned about the noise, but also like I just think the community board should really think about the sheer volume of venues that have opened up. It's just out of control. It's become an international party destination. People come to Bushwick to drink from all over and to party. And I think there should be a moratorium on all liquor licenses within 1 block of the Jefferson L train stop, because right now there are around 30 liquor licenses with 2 pending, and the 4 more that you guys are considering tonight. And the closing times, even for restaurants, are like 2 a.m. They're not like 10 a.m. or 10 p.m. or even midnight. And there's just so many of them are huge. The other night I was walking home on Troutman on Friday at like 9:30 p.m. and there were like 150 people waiting to get into a venue on Irving. And there's a half dozen places like that in the neighborhood now. So I really think like I'm all for living in a lively neighborhood, but this has kind of become a dumping ground. And I'm really worried about how I'm going to sleep if we have another, 1,000-person venue opening on Star Street, which is a residential block. I put my comments in the chat. I hope people will read them, and that's all from me for now.
Thank you. Thank you, because we have a lot of people that want to speak out, so we will have time. We got to be out of here by a certain time. Not that we're trying to rush anybody.
We don't want to rush you, but just a reminder, be brief. We still have other items on this agenda to get through. I see Ms. Spellin next, followed by, I believe, Mr. Ceballos. Ms. Spellin?
One of the things I want to bring up is that we have to beware of the fact that some of these places, if they're denied a liquor license, what they do is they say, okay, and then they rent to people who bring in their own booze. So we got to watch these guys because it sounds like they're up to something that's no good.
Mr. Ceballos?
Yes, good evening. I want to say I'm near to the area, Waco, between Willoughby and Flushing. And like before, the Assemblywoman Marisa Davila was talking about that. It's too much. It's a lot of business together. I know they had the right to go to the board and try to get a letter of support. But we had to thinking about it because it's a neighborhood area in the same time, and nothing too much is good. We have to consider that kind of situation. Thank you.
Thank you, Mr. Ceballos. I believe we also had Christine Malden.
You're welcome.
Christine?
Hi, everybody. I don't want to take up too much time, and I'm not going to really say anything particularly new, except that I do live right next door to both Moonrise and the Xanadu projected location. As I mentioned the other day, the committee approved or recommended even later hours for the new venue that is not Xanadu, but Selva, which is in the same building as Moonrise, but sort of recommended even later hours than Moonrise, even though it's a different business. So what I just wanted to say is that, yes, there are sometimes bad actors, and this is nothing personal. This is, we want everyone to be able to, earn their living, start their businesses, thrive, etc. This is not personal. This is a question of oversaturation. There's just too much. And I think back to the Bushwick Community Plan, and a lot of thought was given to how we want the neighborhood to evolve and how we see ourselves and what the things that we like to protect and how we would like to kind of usher into this new stage of Bushwick. And I just think that the opening of all of these mega venues is not at all in harmony with what the Bushwick Community Plan attempted to do a few years ago. So I'm also a neighbor of the Assemblywoman's, and it really is a mega, everybody comes here to drink, to party, to the number of cannabis trucks. I mean, it's just a circus. So I would really hope that we could think of this from more of a systems approach and not just, oh, there's one bad actor, there's one bad apple in the lot, but like, what are our recommendations? Other neighborhoods like Williamsburg, there are places where they keep, they authorize liquor licenses, but till midnight, or 11 o'clock or something like this. Why we have to give them 4 a.m. liquor licenses across the board, which are not even respected, I just think we need to rethink this a little bit. So thank you.
Anyone else? All right. Oh, we have someone in the back. Please come up. We'll bring a mic towards you.
Hi, I also live across the street from the proposed venue. And I mean, I just worked in like the service industry for a long time. So I know how like these things work. It says like, oh, we're going to close at 4, but that really means like 6 in the morning. Like, let's be honest, like people will still be rolling out of there at 6 a.m. I'm like really worried about the sound. And also like we have a lot of people on our block that have lived there their whole lives. In some ways, I just don't feel that they deserve, it's just like not, it's like not kosher, I feel like, for them to have to deal with like this big mega venue. I don't really have the issue with it being a roller rink. That's not the problem. To me, it's the issue of a liquor license and it being open until, 4 a.m. Those are like my biggest concerns. And this is like from working in service.
Thank you. All right, so I'd just like to point out, we do have the owner applicant here this evening. I defer to the committee chair as well as the board to allow them to say a few words. Oh, Mr. Ruiz, yep, Eliseo.
Yeah, my name is Eliseo Ruiz from the community before. I normally don't say much, but I am very concerned how they are picking. They are picking on this number 5 person on my list, because all the other places on Willoughby, Troutman, the other Star, Stanhope, they all want liquor license and they all want it till 4 o'clock in the morning. The other people are not offering anything for youth and young kids to spend hours skating. Of course, there's liquor there. If I take my son to roller skate, I would like to drink a beer. Not to 12 o'clock or 4 o'clock in the morning, but at a reasonable time to leave. And if you're going with your kids, you're not going to drink. I think we're being unfair to these people because of the youth that are going to be there. And we have given in the past, this is the first time in all my time here that we break number 5. I don't even know what the place is. Number 5 down so hard. I think it's unfair, and we should also think about the conflict of interest when we make a decision on this thing here. Thank you so much. I do apologize if I say anything wrong, but we should really think about letting the kids enjoy themselves. We don't have a roller skate. Only one is in Prospect Park. Thank you, and I apologize again.
Thank you, Eliseo. Melissa?
Thank you. So we want to give everyone has an opinion. I think it's, we all have our concerns and thoughts, but we do want to give an opportunity for Varun to say a few words to the board. Not a presentation, just a few words that you're here.
Thank you, members of the community board, members of the community. Thank you for giving me the opportunity to speak. I hear your concerns. I share them. I operate a business in Bushwick. The Turks Inn and the Sultan Room has been, I believe, one of the crown jewels of Bushwick hospitality. It's a complex business. We have a music venue, we have a restaurant, we have a grab and go. We employ 50 plus people, creating skills. We've taught people how to do sound, how to do lights. There is a robust community of artists. So we are definitely contributors to the beauty of Bushwick. and to the economic resiliency of Bushwick. And we've operated our space very, very well. Your concerns are valid. They're all very, very valid. Noise, misbehavior, et cetera. But we have a track record that speaks for itself. And we've operated our business very conscientiously and built something with a lot of financial investment. And so when you have a lot of financial invested into a space, you also take it very seriously. And I want you to know that this thing that we're offering, we really believe that it's an offering to the entire community of Bushwick. It's not just a niche experience for certain residents. It's intergenerational, intercultural. It's a space that can serve the needs of the nonprofit neighbors that we have. And we want to be good neighbors to you. We want to be good neighbors to any nonprofit. We've reached out to a number. We've reached out to a number of them. So part of the roller skating experience, I'd like to not quarrel if I may. Part of the roller, well, we're neighbors. The roller skate.
All right, one meeting, please. One meeting. All right.
So by offering a roller skating experience, I think that we're offering something very unique to the neighborhood of Bushwick. This is not something that already exists. It's true that we're asking for a liquor license. We're an eating and drinking establishment. We have pizza, we have full dinner menu available. We've got a restaurant that's going to be serving food, and that's part of the experience of roller skating. People are going to want to have their birthday parties there, bar mitzvahs, quinceañeras. So yes, offering liquor because it is part of the celebration experience. That's very much a core to what we're doing. I also want to let you know that not all music venues and not all clubs are created equal. The kind of programming that we have, we do not contribute to fights. We don't have the police coming and dealing with the mayhem that we cause in the neighborhood. Officer Lopez will attest to that. We've been great partners to our local police and community. We have security guards on the street. Our street frontage is kept immaculately clean. We have security cameras. We could frequently provide footage when a crime has been committed in our area. So we think of ourselves as stewards of the block. We achieved a dream with the Turks Inn, and it's proved itself. And I'm asking you to give us permission to dream again and let us prove ourselves to you all once again. We ask for your trust. We do ask for your blessings, and we will stand before you 2 years later and stand by our track record. And we'll have to ask for your permission yet again. We have deep ties in this neighborhood. I've been living in Bushwick for 10 years. I don't plan on leaving anywhere. And so I ask for your trust in this. Thank you.
Thank you, Varun.
Are you you're gonna need employees there, right? Are you gonna hire from? My question is, are you gonna have employees there? Are you gonna hire from our community, from Bushwick here? Thank you so much.
Varun confirmed he will hire from the community. And if I may, do you know how many at this point? Is it too early? Mhm. Okay, 50 plus at Turks Inn, that number or more. And if I may defer to the committee chairperson who did a significant amount of research in advance of this meeting, if you would like to share.
Yes, so just to wrap this up, I do want to share that there are other establishments across the city that have a similar model to what Varun is trying to do in Bushwick, who have hours that look very different from what the applicant has proposed. And I know the committee made a recommendation, but I do my best to educate the committee to make sure that we do our due diligence in making sure that we are not creating more problems to Bushwick because of the hours. You have people leaving at a certain time and they stay on the streets. They're creating a lot of noise, but I will say that there's similar venues with similar setups that are doing activities and serving alcohol across the city. And I can use Brooklyn Bowl as an example, who has gotten their state liquor license in Williamsburg, whose hours are till 11 p.m. till Thursday, and then Friday and Saturday only till 2 a.m. and Sundays till midnight as well, but they are closed Monday and Tuesday. So they have figured out how to run a venue that also does events. They do concerts. Then we also do have another location downtown who also serves alcohol. It's a skating rink as well, a roller rink that has similar hours as well, that closes at 11 p.m. and at 2 a.m. So I don't see why we have to extend ourselves to 4 a.m. when we have so many businesses that are staying out late till 4 a.m. And that doesn't mean people stop drinking once they leave your business. They're going to keep hopping around. They're going to keep moving around. So I just wanted to make sure that the committee and the board members know this information. There are other models like this. The hours are not that late because we have to work with each other. Thank you. Oh, the intended hours are 10 a.m. to 2 a.m. Monday through Wednesday, and Thursday, Friday, Saturday, 10 a.m. to 4 a.m. and then Sundays, 10 a.m. to 12 a.m. as per stipulations.
The actual hours will be discussed under recommendations. We have to move on. We have several other reports and everyone's going to be mad that we're meeting till 9:30 tomorrow. So let's thank you, committee chairperson. Thank you everyone for your comments. And we will move on now to our next committee report, which is environmental protection, transportation, sanitation, parks and recreation. Barbara Jackson. Barbara, are you there? Oh, go ahead.
I'm gonna be real fast, real quick, because it's past my bedtime. We met on March 22nd. DOT was supposed to come, but they didn't show up. They want to have an open street Trotman between St. Nicholas and Irving Avenue, and from St. Nicholas almost to Irving, there's nothing but bars and restaurants. So why they need a permit from 10 a.m. to 10 at night? We need more questions and more answers from them about that. Also, I attended three other meetings this month. And also I attended the police academy, and that's my report. Oh no, the lady from sanitation came. Shante, she gave a very detailed report on the sanitation and the garbage in Bushwick. And the bottom line is we need to find a way how to educate the people in Bushwick what to do with their garbage and how to do their garbage. That's my report, short and to the point. Are there any questions?
Thanks, Barbara. Just a point of clarification again, DOT was not planning to attend the meeting. It was informational for the committee to provide feedback. What DOT could have done that they failed to do was let the actual applicant know. The applicant did email the board's office and indicate DOT failed to tell them that there was going to be an opportunity for them to engage with the board. The applicant is here this evening, has provided information, wants to be involved, wants the board to be involved, has spoken with Mr. Camacho. So I defer to the board if you would want them to speak briefly now. They're not on the agenda, but it is the board's choice. Mr. Camacho said, no, like a minute, 1 minute, 1 minute. It is already 9 o'clock. 1 minute, please.
Okay, cool. Thanks for letting me come down and take up a minute of your time to speak about Troutman Open Streets. We have 17 businesses on board. Thus far, we've redone all the tree pits. We're involving Clean Bushwick Initiative for trash mitigation. And we have the DOT's approval to do a full closure every Saturday and Sunday from April 22nd to October 31st. We've had the DOT to our meetings at KCBC Brewery 3 times, and they have advised all of us as businesses to operate within strict observance of the SLA laws outside by their dining areas. I run a 5,000 square foot buy-sell trade clothing business that we buy clothes from residents of Bushwick and beyond 7 days a week. We paid out over $250,000 last year to this community for their used clothing. And I spearheaded the event because, or the idea because there's such a minimal presence from residents from Irving to St. Nick, and to make a soft impact was the goal, but to also have some reciprocity. So while we ask for something from the DOT and the city and the community, you know, we're getting people involved like Clean Bushwick Initiative, and we offer the nonprofit tabling time from 10 to 1 on Saturdays and Sundays. So our goal is to expose as many nonprofits as we can from Bushwick, and then to have a good time on an open street Saturday and Sunday. We have volunteers, we have funding from the DOT, and we started a nonprofit called the Bushwick Foundation for Artists and Merchants, because one feeds the other. So we need a funding arm for our Troutman Open Streets organization. And that nonprofit is called the Bushwick Foundation for Artists and Merchants. I'm committed to the beautification of the neighborhood. There's never any problems with Turks Inn. The problem in the neighborhood is litter. It's a huge problem. And we businesses on Troutman, the 17 businesses that are on board, are committed to improving that street. And if you walk down it thus far, we've installed 20 tree pit frames that I designed. They've been composted, soiled, mulched, and planted with perennials that will come back every year that are drought tolerant. We have the Queen's Botanic Garden involved, and volunteers as well who are helping us maintain the tree pits. I used to be an urban landscaper. I'm a business owner now, but I know that landscaping and beautification is a great way to merge with the community for a larger agenda of harmony. And to create harmony in a community is our goal, and to, live in the kind of world that I want to live in, where it's peaceful and, there's reciprocity between the community and the business. So all the businesses feel that way. And thank you for your time.
Thank you so much. If anyone has any questions, we will refer them to committee. We have to move the agenda on. So thank you for being here and sharing that information. We will absolutely follow up. And now we will move on to our Housing and Land Use Committee report. Anne?
Hi, everybody. Nice to see everyone's faces. And this has been very, very interesting. This report, I think, is quite relevant to a lot of the conversations that have gone before. So our meeting was Tuesday, March 28th, and we had two items. Councilmember Jennifer Gutierrez from the 34th presented the land use policy that she and her office have developed for the 34th. The whole district, not just Bushwick. Obviously, the 34th is a lot bigger than just Bushwick. So there's a terrific, very short write-up in the committee notes. Thanks to Celeste and Kim of the office for the précis of the land use policy, and then to Christian Celeste Tate for the write-up of the discussion that we had, which was very robust. Very briefly, and we're talking 30 seconds brief, it is really looking at the potential for development proposals to minimize any kind of displacement for existing affordable housing units, and the fact that the values of this are heavily based on the work that many people in this community did for the Bushwick Community Plan. There are really interesting notes on housing, on land use and zoning, manufacturing, an inclusive economic and workforce development approach, and labor. So we talked for a very long time. The notes are terrific, not that long, and I heartily recommend that everybody looks to them because of the time. But I really don't want to stint on that. There was nothing to vote on. Councilmember Gutierrez said that this is it's in process. It will continually be developed, and therefore is always looking forward to input from all actors and stakeholders in the community. The second item on the agenda was Katie Lassell from the Right to Counsel Coalition. This is a broad-based effort to really make sure that there's free legal representation for all tenants who are facing eviction and for small landlords facing foreclosure. So we had a really robust conversation about this. Bushwick has seen a spectacularly large amount of displacement over the last 20 years, especially the last 10, I would say. We could look at those numbers. There is a statewide right to counsel effort that is really trying to make sure that people who are facing eviction or facing foreclosure have access to free legal counsel. So again, really, really robust conversation because especially in the lower part of Bushwick, there are a lot of longtime homeowners that became part of the conversation, but we're also really focused on keeping tenants in their units. I would again refer everyone to the notes, which are fabulous and very detailed, but it's not going to take too long to read. And so that was really it. We did recommend, the committee recommended that the Right to Counsel Coalition come before and make a public hearing presentation so everybody can ask all the questions. And then finally, that we asked them about their timeline, and Ms. LaSalle from the Right to Counsel Coalition said it was a 5 to 10 year horizon that they are working on this. It's not an immediate rush, but I think it was intriguing, and I hope that everyone has a chance to read the notes and also reach out to committee members, myself included, if you have any questions. Anything else?
Thanks, Ann. Any questions, board members? Members of the public? All right, seeing no hands, hearing no voices. Thanks, Ann, for the overview. All right, we will move on now to recommendations, and we will start with the Civic Public Safety Religious Committee for the Eldridge Street co-naming. Is there a motion from the board? Joshua Brown made a motion. Wait, we have to hear his motion. Is your motion, what is your motion? Okay. Yeah, motion for the committee's recommendation.
Barbara
And
Smith.
Eliseo Ruiz seconds. Oh, sorry, beat you to it, Barbara. All in favor? Any opposed?
Aye.
Any
Aye.
abstentions? Hearing none, so moved unanimously. Thank you.
Yay. Thank you, board.
And we will certainly keep everyone posted on next steps. There will most likely be a ceremony. The council only has 2 periods. We just missed the spring period for them to submit, so they will have to submit this, I believe, in November. And then after November, it will have to go before a council hearing, which will become officially law. And then DOT will have to follow up with the signage. So it may be next winter when we see the sign actually on the street, but we will certainly keep everyone posted. And next we have the executive board. The executive committee recommendations, executive board recommendations, Mr. Camacho.
There were 2 recommendations. There was one for Kimberly in regards to a 3% merit increase. And the second one is for Celeste de Leon. We know she's doing a good job. She drives me crazy all the time. I don't know, but for a 7% increase, I know there is a little money there because they gave me the info today. So I need someone to second or make that recommendation or second
James
that.
Stewart makes the motion.
I second.
Okay, just for clarification, Reverend Stewart, was that you making a motion
Yes, ma'am.
for both?
Yes.
Okay.
I
Is there a
second.
second?
Yes.
Melissa Carrera Solano seconds. All in favor?
Aye.
Any opposed? Any abstentions? So moved. Thank you, everyone. Kim says thank you too. Kim says thank you too. Kim.
Thank both of you.
I know
It's a
you got a
no-brainer.
crib
Thank
now.
both of you for all you do.
You're doing a good job.
So we will move on now to our economic development and our permits and licenses. I have a suggestion. Let me just pull up that report really quick. So I believe that Key Bar at 143 Troutman Street, as well as Pitanga, 207 Star Street, were not as controversial as 2 of the other applications. And I might be missing one more. Let me just, oh yeah. And then we also had the applicant that wasn't there. So let me, Melissa, do you want me to read out so the ones that were less controversial are Key Bar, which is located at, give me 1 second, 143 Troutman Street. And then the next location that is less controversial is Pitanga Wellness, the restaurant at 207 Star Street. And then we also have the last one was the 269 Stanhope Street. Now they weren't present. However, they are located next to a church. So the recommendation for them is specific to that. So Melissa, do you want to go over those 3 recommendations first, just for those, and we can separate the other 2?
Yes.
Since they were controversial.
Yeah. So the first recommendation for the two not less controversial establishments are as follow. For 143 Key Bar, Troutman Street, the recommendation is to approve with the hours stated in our report, which are as follows: Monday through Wednesday from 10 a.m. to 2 a.m. and Thursday through Saturday from 10 a.m. to 4 a.m. and Sunday from 10 a.m. to 12 a.m. And the next applicant is for Pitanga Wellness located at 207 Star Street with the hours stated in the report as follows. One second. So Sunday through Wednesday from 8 a.m. to 12 a.m. and then Thursday through Saturday from 8 a.m. to 2 a.m. Does anyone want to make the motion? Or
Do you want to add the church, the one next to the church as
oh
well?
yes, let's add the
Yeah.
church one in there. And then the third one is Lolia at 269 Stanhope Street. The recommendation is to modify the recommended sales of alcohol hours, which are Sunday through Friday from 5 p.m. to 12 a.m. and Thursday to Friday from 5 p.m. to 2 a.m. And as per the 200-foot law, the applicant would have to downgrade to just a beer and wine license. That is our recommendation for this establishment.
Is there,
Yes.
yeah,
They're
Yeah.
only allowed a beer and wine. They cannot
With the
sell
church.
full liquor.
yeah. Is there a motion from the board for a blanket vote for these three? Oh, Ben Tucker makes, and Mr. Camacho seconds. All in favor? This is just for the blanket vote. Any opposed, any abstentions from the blanket vote? Okay, so moved. Hearing none. Now for the actual recommendation. Is there a motion from the board? For the, Josh Brown makes the motion in support of the committee's recommendations. Mr. Camacho, Tashana Wade, we'll say Tashana Wade, we'll be fair. Tashana Wade seconds. All in favor? Any opposed? Oh, Alvina, okay, so none opposed. Okay, so Alvina Davis abstains, Raul Rubio abstains, any other abstained?
Joanna Bennett abstains.
Zinavoa abstain.
Okay, one at a time. Zuma Novoa also abstains.
Annette Spellin abstain.
Annette Spellin abstains.
Carlotta Williams.
Carlotta Williams abstains.
Barbara
Felix
Smith.
Ceballos, Felix
Okay,
Ceballos.
Barbara
staying.
Smith, Felix Ceballos.
Did you get Joanna Bennett?
I did.
I abstain.
All right.
So,
Okay, Stephanie, you also abstain?
yes.
I abstain.
Was that a yes? Your sound cut out, Stephanie. Was that an abstention?
Yes.
Okay, thank you. All right, so I'm gonna read the list just to make sure I have everyone. I don't want to miss anyone. We do have to document this. Alvina Davis, Raul Rubio, Joanna Bennett, Zuma Novoa, Annette Spellin, Carlotta Williams, Barbara Smith, Felix Ceballos, and Stephanie Anderson abstain.
I'm abstaining, Celeste.
Okay,
Sandoval.
okay.
Abstain.
Joanna, do you also abstain?
Yes, ma'am.
Okay. That is 12. The motion still carries. Thank you, everyone. All right. Yeah, we're gonna do 1329 Willoughby first. Yeah, we're
Thank
gonna
you,
get that out.
Stella.
Yeah. Melissa?
All right, so the recommendation from the committee for Selva LLC located at 1329 Willoughby are as follows with the hours stated above. Give me 1 second. Monday through Wednesday from 8 a.m. to 2 a.m., Thursday through Saturday from 8 a.m. to 4 a.m., and Sundays from 8 a.m. to 12 a.m. And just a reminder for everyone, if we do not put in a recommendation, the applicant might as well go to the SLA and ask for 4 a.m. every night. So just want to remind everyone, that doesn't mean they're guaranteed to get it, but I just want to make a reminder for folks. So the recommendation is that, does anyone make a motion? Or
There's a point of information, as we heard earlier from someone across the street. The current hours of the most problematic business on the block, Moonrise, also at 1329 Willoughby, is only until 2 a.m.
Yes.
So they had asked for consideration for the hours to be the same, to be in conformance, not to be longer. It is up to the board to make a motion on the committee's recommendation, as Melissa said, or to make an amendment to the recommendation. What would the board like to do?
Is this for the Turks Inn?
No, this is for 1329 Willoughby Selva LLC. It's a bar tavern.
Okay, thank you.
So Mr. Camacho would like to make a recommendation of. So Mr. Camacho, if I'm understanding this correctly, wants to make the recommendation as the same hours. It's an amendment, essentially. An amendment till 2 a.m. like Moonrise. Okay, so to be clear, that would mean that the hours would change Monday to Saturday until 2 a.m. And then Sunday would still be midnight.
Yes.
Okay. Do we have to make a motion on the amendment?
Yes.
Okay, so someone can make a motion on what was suggested to be amended.
I make a motion that we.
Okay, so Josh makes it. Do you want a second, Barbara? Was that a second that I heard for the amendment?
Second, yes.
Okay, all in favor?
Aye.
Opposed? Any abstentions?
Carlotta Williams.
Okay, raise your hands, please, because I imagine we're gonna have a lot of assumptions. So I got B. Tucker, I have R. Rubio. I have Z. Navoa. Who else? Alvina Davis.
Barbara
I
Smith.
see Barbara Smith.
Joanna Fuentes.
Joanna Fuentes. Oh my gosh. All right. Maybe we should have just asked who doesn't abstain at this point. Let me see. Just kidding. That's some parliamentary humor. Stephanie Anderson. Let's see. Asai or Polite. All right. I can't see. Carlotta Williams. Thank you, Kim. I think Cassandra LeVay. Felix Ceballos. T. Honeygan. So, okay. I mean, folks recognize that when you abstain, it counts as a no vote. So you're essentially saying no to changing the hours to 2 a.m. instead of 4 a.m. Just want to make sure that's really clear. So I don't know if that changes anyone's, some hands go down. I will say the list. I will say who I have here, and then you tell me if you still want to abstain with that clarification. So I have Ben Tucker. Still abstains. Raul Rubio still abstains. Yes? No. Okay. Removed. Zui Navoa, do you still abstain?
Remove.
What?
You can
Remove. Okay. Remove. Seat. Alvina Davis still abstains. Barbara Smith
Yes.
still abstains. Joanna Fuentes.
Remove.
Oh, remove. Okay. Stephanie Anderson.
Remove.
Okay. Asira Polite.
Remove.
Okay. Carlotta Williams.
Still abstain.
Okay. Cassandra LeVay.
Remove.
Okay. Felix Ceballos.
No.
Okay. Tanisha Honeygan.
I'm not abstaining.
Okay. So remove. Joanna Bennett.
Removed.
Okay. All right. So I have Ben Tucker, Alvina Davis, Barbara Smith, and Carlotta Williams abstained. No one else abstains. This motion carries. Thank you, everyone. All right.
All right, last up, we have the committee's recommendation. 262 Tar Street between Wyckoff and St. Nicholas. So the committee recommended as follows: Monday through Thursday from 10 a.m. to 2 a.m., Friday through Saturday from 10 a.m. to 4 a.m., and Sundays 10 a.m. to 12 a.m. as per our stipulations. And I know Mr. Camacho wanted to.
This is discharge. I'm discharging the committee. When community board wants to stop a committee from considering an issue forward, this motion is to be used. But the motion can only be introduced before the committee has made the final report, which she did. And this motion is amendable, which I have our first vice chair is gonna make the recommendation.
given the input from all community members on all sides, we've heard the pros and the negatives. And given that as if we don't take action, it's a possibility they'll get a default judgment of a 4 a.m. Community Board 4 proposes that we offer a.m. letter of support with the condition that Sunday through Monday, the operating hours, Sunday through Thursday, the operating hours will be from 10 a.m. to 12 a.m. And on Fridays and Saturdays, the operating hours will be from 10 a.m. to 2 a.m. And with that, we will be voting to offer a letter of support.
Is there a motion for this amended recommendation? Eliseo makes a motion. Oh,
Second,
sorry, I didn't catch.
Aye.
Oh, wait, I need a name. Shout your name.
Felix Ceballos, second.
Okay, Felix Ceballos seconds. All in favor?
Aye.
Any opposed?
Right.
Any abstentions? Okay. Let me get the usual abstentions. I got Avina Davis, Raul Rubio. Any other abstentions?
Carlota
Oh,
Williams.
Melissa Carrera Solano abstains.
Barbara Smith,
Barbara Smith abstains.
Carlota Williams.
And Zuma Novo. Okay, okay. C. Williams. All right. And Joanna Bennett. All right. So I have Elvina Davis, Raul Rubio, Melissa Carrera Solano, Barbara Smith, Zuma Novoa, Carlotta Williams, Joanna Bennett. Any other abstentions? All right. Oh, Tanisha Honeygan
And Asaya Polite abstains.
and Asire Polite. Yep. 9 abstentions, the motion carries. Thank you, everyone. All right, that concludes recommendations this evening. We will move on now to old business. Is there any old business?
No.
Going once, going twice, new business. This might be new old business. I can never tell, but we did get an email from the State Liquor Authority this week. It is an investigator for 1329 Willoughby Moonrise. They asked for me to describe exactly what's going on there. I wrote them 3 very detailed paragraphs about what we've tried to do, what we've attempted to address with the owners, what the precinct has attempted to address with the owners, what pretty much everyone has attempted to address with them, and what they continue to do. So as I get more information, I will of course update the committee chairperson. That's a separate business, same address, separate business. So they are being investigated. This is Moonrise, the one that the assembly members spoke about earlier. They are now under investigation. So that is all the new business I have. If there's no other new business, go ahead, Ann.
Yeah, I just wanted to say that based on so much of the feedback today, I think it would be really wonderful, really important if we as a community can come together and sort of work through what are options, what's best for everybody to come up with a better policy for liquor licenses. We've talked about this honestly for the last year, 18 months in committee and at board meetings, and voting up or down individual businesses doesn't seem like the smart way. Maybe we can come up with a comprehensive approach. Some people have proposed moratoriums. Other people say it's good for business. Let's all come together and, do some kind of process where we could actually raise all these issues. So that would be my proposal for new business.
Yeah, you're 100% right. Maybe we should talk to elected officials to enforce the 500 foot rule, and then we won't have all these complaints that we're having. Because what's happening now is the stores that's supposed to be selling sneakers, they can't afford to pay the rent. The churches that can't afford to rent the places can't afford to pay the rent, because now liquor is more important than us praying and more important than us buying clothing and stuff. So we need the 500 rule to eliminate all this, and people can rent their places in a decent environment and take care of their business and have our stuff.
That's right, Mr.
I'd like to say something.
Just a quick reminder that the 500 foot rule exists. The public is available and welcome to always join the hearings. So if people feel passionate about a certain establishment, as many people do about Moonrise, etc., you have the opportunity to speak about this at the hearings. So there are other ways to navigate this. We are an advisory board. There's only so much we can do. I do think that we can come up with other systems in place, but it is very challenging with the influx of businesses coming in looking for a liquor license. Thank you.
The only other point that I will add to this is that we know we have packed agendas like this evening. The committees also hear a lot of information. And so there needs to be time during committee meetings for other discussions around planning and policy to take place. This particular committee meeting, there were not those discussions. I remember because I had to leave the office at 8 because the building closes at 8. But of course we will plan ahead, all committees, to leave space for these important conversations to take place.
Right.
If there's no other new business,
I just wanted to
Ms.
interject.
Bennett, go ahead.
Yeah, I just wanted to interject to find out at some point, does the 500 rule also apply to smoke shops?
No. Separate rules and regulations. If you'd like a little bit, anyone that wants more information on how smoke shops are regulated can always contact me in the board's office and I'm happy to provide. And cannabis, just to be very clear, there are no licensed cannabis retail providers in Bushwick right now. None. Anyone that is selling cannabis in Bushwick right now is illegal.
Well, then I'm gonna be telling you about.
If any folks need to make a complaint about one, please contact the board's office. This is not the time to bring it up.
I'm buying the wrong thing.
We now have
Damn.
announcements. We will move on to announcements. 1.5 minutes.
One
Please
minute.
raise your hands if you're on Zoom. If you are in person, please let us know.
Barbara Smith.
Go ahead, Barbara. You can go first.
Hi, I'm Barbara Smith. I'm also the president of the 83rd Precinct Community Council. I want to bring to the community that the 83rd Precinct Community Council are having their summer camp program again this year. We're getting ready to get the flyers ready. I'm announcing it now because we're gonna charge a fee. And I want all people that's interested to start putting their money together. So when we get the applications out, you'll be able to give a down payment. I need people to know. Last year, we had a lot of problems. People would pay their money down, but they didn't have their kids' physical filled out. We cannot, even if your money is down, paid in full, if your child's physical is not filled out, we cannot accept the child into the camp. The camp is going to start from 8 years old to 12 years old, 5 days a week. The location is going to be in Bushwick High School and it's ran by the youth officers in the 83rd Precinct, and the 83rd Precinct Community Council oversees this. So I'm giving you a heads up now. So people, if they want their kids to come or know any kids that want to come, they could reach out to us now and get started. Thank you.
Thanks, Barbara. All right, everyone else has a minute and a half. We're timing you. Councilmember Nurse's office.
Hi, everyone. I just want to say that we are hosting an Irving Square Park Town Hall on May 10th at 6:30 p.m. at PS 151. There is an Eventbrite. There is a flyer. It has all been shared with the board today. It's also on the council members' social media, CM Sandy Nurse, on all platforms. Please register in advance. We need a head count for the school. Bring your ID the day of. We're going to be there with New York's Park Brooklyn Commissioner, talking about plans for the park, including events, bathroom, dog run, play area, etc. I just wanted to say that we have the total counts of participatory budget votes. For the very first time for us, we collected 2,243 votes, which is a huge deal for us. I'm very excited about bringing this into the next cycle and hopefully see that number increase. And we had a successful street cleanup event this past weekend where we composted and mulched 28 trees and collected 10 bags of garbage from Putnam Avenue between Wyckoff and Irving. There will be more events like this coming up through the district, and we'll be announcing our summer events soon, such as movie in the parks and others. So stay tuned.
Right on time, Fran. Thanks for the updates. Next, we have District Attorney Gonzalez's office.
Hello, good evening. Just two events that are coming up. Just wanted to give everyone on everyone's radar. This Friday is a expired prescription, unused prescription drug take back. There's multiple drop sites throughout Brooklyn, and it'll be running. The most local one is at Hope Gardens, where the meeting is actually 195 Linden from 9:30 to 3:30 p.m. You could see it more online on the different feeds, as well as in 2 weeks on Saturday, April 29th. New York State Attorney General Letitia James and other elected officials, most of the ones who are on here, we're all hosting a gun buyback in Williamsburg, All Saints Roman Catholic Church, 115 through, right near Woodhull Hospital, and that'll be from 10 a.m. to 1 p.m. And you could see the flyers online. Thank you.
Next, we have the Brooklyn Borough President's Office.
Hi, everyone. Three quick things. One, as I mentioned earlier, hi, congratulations, Mr. Camacho, and everybody else who got elected, and also to Celeste on your race. Very well deserved. Okay, you're taking my time though. First, new members coming your way next month, as I mentioned before. Number two, we were very excited to welcome our new deputy borough president this week. In case you missed it, her name is Reverend Kimberly Council. She joined us starting on Monday. Before coming to us, she was the assistant pastor of Greater Mount Pleasant Baptist Church in Crown Heights. She's going to be handling faith-based work in our office and other special projects. We're really excited to have her. You'll probably start seeing her out in the community. Number three, on Tuesday, I will be doing a presentation at the Land Use Committee for CB4 about our comprehensive planning effort for the borough. Really excited to dive into that with you all. If you need details about that, I guess talk to Anne. So I'll see you all then. Thanks.
Thank you.
And you better and you better tell the new one to come here to come visit us.
Yes.
For sure.
We welcome both the president and the deputy borough
Oh
president to come visit us.
because he
Both-
always
both.
come here. He always come here. We normally throw him out, but you gonna get the borough president. I'm gonna
All right. Next announcement, we have the office of Congresswoman Nydia Velasquez.
Good evening, everyone. Let me keep this very short and sweet because I know we all want to go home. I just want to mention two things. First, today the Congresswoman joins Senator Kristen Gillibrand and Congresswoman Grace Meng in applauding the approval of New York's SNAP fraud reimbursement plan. As we all know, we've been seeing a lot of SNAP recipients being scammed recently from their benefits. So the Congresswoman alongside Senator Gillibrand and Congresswoman Meng jumped into action to address this issue. Now, with the approval of this reimbursement plan, New York can now process household claims of stolen benefits and reimburse households using federal funds through the Department of Agriculture. Second, I just want to mention, since Mr. Rodriguez was here and he gave a great presentation, I just want to remind you all that the Congresswoman secured $2 million for Wyckoff Hospital as well as Woodhull Hospital. Thank you so much and congratulations to everyone. Congratulations, Mr. Camacho, on still being chair.
Thank you. And Councilmember Gutierrez's office.
Hey everyone, so quick updates from our end. Our office is working on community cleanups and I will send that information out to the community board when we have everything set. On Wednesday, April 26th, we're gonna have NYC Care table in the front of our office. We're doing this in partnership with Make the Road. That will be from 10 a.m. to 2 p.m. And I'm excited to announce that District 34 had the most votes for participatory budget. We were able to collect 6,527 votes, and we will be announcing the winners shortly. Thank you.
Thanks, Juan. All right. Oh, the Assemblywoman or a rep? Okay, the Assemblywoman is still on. Go ahead, Assembly member. You're muted if you're trying to speak.
Okay. Can you hear me? Yes? Okay. So currently right now, I am in Albany. We are trying to come to an agreement with the governor for a $242 billion budget, which does include the safety net hospitals. It includes housing which is one of the biggest problems that we're having right now, the 421A and the oversight and other issues that are transpiring. So we are late in the budget, but that we are late because we are holding back on a lot of things that we know is not beneficial to our districts as a whole. Hopefully by next week, we should have a plan. But again, we are holding off on a lot of things until we get the results, so that we can go back home with a very robust budget. In terms of the community, and I apologize before Ms. Bennett, I represent 130,000 people in this district, not 5, not 50, 130,000. And it is important that, you know, when I get an opportunity to speak, that I finish my thought, because right now we're having a lot of issues in our community, and that I wanted to finish the thought about the drug issues that we're having in Bushwick. Okay, we are being inundated. On Saturday, I did a walkthrough with the district attorney, because as we are aware, you know, a lot of us are being pointed out because they think that criminal justice reform is the cause of all the issues. No, we do not have chemists in our communities. This is coming in, it's everywhere, but we must also pay mind to those issues in our community. And with that said, I'm trying to get not-for-profit drug programs to set tables up in these areas that are really inundated. Just wanted to let you guys know that we also have a program that is going to give them, and this will help with the cleanup in Bushwick, containers for the hypodermic needles. So a project is coming up. As soon as we have all the details, La Nueva Esperanza will come in front of, we'll ask to come in front of the community board to let you know how it works. So that's my whole, and I'm sure that Yvette will, you know, she sends out all of our events schedules. We give them to Camacho, and he's always been part of everything that we do. So thank you once again for allowing me to come on. Thank you.
Thank you, Assemblywoman. Yes, I know, and I know that Yvette and your staff always send us stuff, and I normally send them down. So we'll work together. Thank you.
All right, close this out, Ms. Chambers. Danielle
Yes,
Chambers.
thank you. Thank you so very much. I am the coordinator here at the Bleecker Street Block Association. Good evening to each and every one of you. Congratulations to our illustrious chairman, Camacho, as usual, always very visible and very vocal. We appreciate that, and the new and renewed confidence to each member. I want to congratulate each of you. I represent also Calvary and St. Cyprian's Episcopal Church, located at 966 Bushwick on the corner of Minahan on Bushwick. We will be having our annual health fair that will be sponsored by the church on Saturday, June the 3rd. More information in the form of a flyer will be available to the board and also at the board meeting by the next meeting in May. I would like to thank each of you for this time.
If you have a cuff announcement, now is the time. It's past the time. She was supposed to close us out.
Sorry. I just wanted to say that we're in Albany last week about buildings like 1376 Avenue that put on a affordable housing lottery for families that make $156,000. Sorry, that is the 421A program that we're trying to stop. Buildings like that could have been an opportunity for low-income families to have affordable housing in our district. That building just went up. They probably got very little applications from Bushwick, so we're working really hard to ensure that program has ended. And when the new buildings start to come out, they're more relatable to the families that make low AMI in our community. So I just wanted to flag that those buildings are wrapping up their last few sites. And that just came out last week at $156,000. That was 8 units on DeKalb. It could have went to 8 families in our district that really need it. So that program is deadly. I want to give props to Assemblywoman Davila and the Senate and the Assembly who are fighting to end this program. And we just got the word that I think is going to be out of the budget and be kicked off to the session. So just want to share that with you. I will continue to fight that, and hopefully we can get a better program up in Albany.
Thank you. All right, that is the end of announcements. Second roll call. Board members, be ready. Hopefully you are still here. Carlotta Williams.
Here. Good night, everyone.
Shauna Wade.
Here, good night, everybody.
Gary Valentin is excused. Ben Tucker. Present in person. James Stewart.
Present, good night.
Annette Spellin.
Present and good night.
Dustin Sonborn.
Present.
Barbara Smith. Milagro Sandoval.
Good night.
Present, good night.
Oh, gotcha, Barbara. Eliseo Reese. Present in person. Raul Rubio. Present in person. Asaya Polite.
Present.
Kyle O'Rourke. Zuma Novoa. Desmond
Present, good
Monroe.
night.
Gotcha, Z. Desmond Monroe. Imani Mitchell. Mary McClellan. Cassandra LeVay. Koebe Cote. Nicholas Kaplan. Luisa Jose. Virgie Jones.
Present. I was here before.
Who's, oh, gotcha, Virgie. It's very low sound. Barbara Jackson.
Yeah, yeah.
Tanisha Honeygan.
Present.
Dia Harrison. And
Present.
Can't hear you, Celeste.
We lost you at Hadia Harrison.
They pulled the plug on Celeste.
Oh, wow.
She's coming back. Still no volume, Celeste.
Dustin, good job, Dustin.
Good night, everyone.
Thank you.
Good night,
job.
everyone.
Good night.
Yeah, back to CB4, we can't hear anything from you guys. So, but I think we're all done. Sounds like we all got roll call done.
Yes, we're done.
Okay.
I
Good
think
night,
so.
everyone. Nice to see you.
Christopher
Good
Graham
night,
present.
everyone. Take care.
Christopher Graham present.
I'm present, Joanna, present.
Stephanie Anderson, present.
If you